County Board of Education. The first thing is roll call. Miss Richardson is absent. Hopefully she'll be attending later. Now we'll have the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we have no communications. Are there any proposed amendments to the agenda? All right, the superintendent's report, Mr. Hawkins.
Thank you, Ms. Evelyn. Good evening, and thanks for tuning in to our July Board of Education meeting. The preparation for this school year has been unlike any other in my career. Things change rapidly, which leads to modifications and adjustments in plans that have been established and ready to implement. Just when one situation is resolved, another comes up that had not been anticipated. We are in a unique situation that requires us to balance concerns and anxiety from staff while knowing that a large number of families want to have their children back in the classroom. There is no perfect solution, and I want to assure our community we will do our absolute best to have a quality re-entry to the 2020-2021 school year. I appreciated receiving results from a recent survey provided to teachers in the district. My staff has already met to discuss the information. I do understand and appreciate the anxiety being experienced now. This is a situation we have never encountered before. As we continue to prepare for the new year, we will focus on these concerns and work to ensure they are addressed in the best way possible. I want our staff to know they can share any concern they might have with their building principal, and the principal will involve any district staff needed to help address the issue. It will take all of us working together to make the start of the school year successful. As you may have heard today in the governor's press briefing, new restrictions were put in place to help slow the spread of COVID-19. We will continue to monitor how things progress in the coming days. The impact of the virus may cause us to change our reentry plan, and I'm asking that parents begin preparing for such a change. Again, there is no perfect solution to this situation, but please know that any decision made will be in the best interest of our students and staff. Thank you again for tuning in this evening. It's an honor to serve as your superintendent, and I know with all of us working together, we can become the flagship school district in Kentucky.
Thank you, Mr. Hawkins. Next, I'm so excited. Cassie Prather, the director of the Woodford County Health Department, is here to answer any questions. Whoops. I sat on everyone's desk. I had asked if you had any questions for Ms. Prather to send them to me. I didn't receive anybody from any board members. If I did, I missed it. But what I did do that I told her I would do when I invited her here was kind of go through our town hall questions that we had received, and a lot of them had, the answer was, well, that's going to depend on the health department. So I tried to pick those out, put them in general categories, and I did send that to her last week. So I've given you each copy of that. I don't know if this, obviously anybody can ask any questions, but maybe this at least will provide us a preliminary format of how to go through the topics, if other board members are fine with that. So do you want to come up to the podium so you can be caught by the camera? And
Thank you very much for that. Huge help.
do you want to tell us anything quickly about yourself or introduce yourself first, or how long you've been here? And
Sure. So my name is Cassie Prather, and I've been the Public Health Director at Woodford County Health Department for now going on 3 years. And before that, I served in multiple capacities at Montgomery County Health Department. I started as a health educator, and then I trained to be an environmentalist, a health inspector, and then I transitioned into more health assessment, health policy, that type of a role.
Okay.
And I furthered my education. received my Master of Public Health degree at EKU and decided to spread my wings and apply for public health director positions because I had multiple interests in public health. And this is where God led me, and I'm thankful to be here and serve the community in this capacity. I wanted to thank you all for inviting me to be here tonight. This might be the first time that you're seeing me at these meetings, but I can assure you that we've been working diligently to get our kids back to school as safely as possible. So I want to thank Mr. Hawkins, Mr. Wells, and Mrs. Simpson because we've had open lines of communication throughout the summer. We've conducted walkthrough assessments in all of the schools. We've been on different types of buses. We've been in all the cafeterias. We have reviewed training plans. We've reviewed return to athletic plans, multiple areas where we have been assisting Woodford County Public School System in returning as safely as possible. And so much so that we've actually created a COVID Healthy at School team at the health department, which consists of myself, Carrie King, a registered nurse, and then also Barrett Scheck, who is our environmentalist at the health department.
What was his name?
Barrett Scheck.
Okay.
So if you all have any questions.
Up there, that's more comfortable.
Okay.
Yeah.
Great. Thank you. Thank you. So if you all have any questions for me, I'd be happy to try to answer those for you tonight. This is evolving, and so there are things that we learn every day, and as we know better, we do better when the science improves and we review our policies and things like that. So just continue to work with us and Mr. Hawkins on bettering the plans as we have more data available that suggests we should change them.
Okay. I think one, my overreaching thing is because we, parents are coming to us for what the answers to some questions are going to be, and then we have to say, well, that'll be up to the health department. The more that we can include in our communication to our parents, like what your answers are too, so they don't have to, everybody can get a sense of what is a protocol and what is still evolving, and then what is just going to have to be case by case. Personally, I hope there's fewer case by cases because that's unfair to our staff. I mean, you don't want to be making the decision when things happen. As much as you can set up some kind of protocol before a situation happens, the better. But so that's kind of how I outlined what we were talking about. So I'll just start, and then you guys jump in if you have questions. The number one question I'm getting asked, and people are saying, is why isn't there a metric for when we can open? I don't know if the state has set a metric. Of course, people send you stuff from other states, from other, I don't know. Everybody seems to have a metric but us, but that's probably not true, right? So is there any metric of when it is safe to open that the state's given you or that you've developed?
So there's not one locally, and there's not one at the state level. And to my knowledge, according to Dr. Meserly, because I consulted with her this afternoon, and she's actually one of the folks on the team that created this guidance on safety expectations with KDE and DPH. One of those has not been created yet. I don't know that it won't be, and certainly if it is, we can share that. But I think right now it's going to be a district decision, and it's going to be based on our case counts. And so right now we remain pretty steady. Overall, we are seeing an increase or an uptick as a state, and we have contiguous counties where they are seeing an increase as well, namely Fayette and Jessamine. So we just need to continue to monitor the cases and, again, be flexible. And
so there's not really
there is not a
point
metric
where you say we have this many, or our positive rate is this much.
Right.
Okay. All right. And then I guess this is probably going to be the same answer. Is there a metric for determining when a school should close if it doesn't?
Right. So that's something that we will work with the schools to determine. And it's my understanding that with flu or any other communicable disease, there's a threshold that you all have to meet. Is that correct, Mr. Hawkins?
There's not a set number.
Okay.
I think there's a number that, we try to monitor our attendance percentage very, very closely on that. And we look at it across the district. but it's usually based on absentee rate.
Right.
Or if we have a significant number of staff members out, that type of thing.
Right.
So there's not a set percent, like, well, once we get to 10%, we don't close or something.
And I don't think we could use a flu comparison if we had one, you know, in comparing apples to apples. That I'm not sure that's a.
There's two different
It would
animals.
definitely, yeah, it would definitely be different, but I figure at some point there will be some type of a threshold
Sure.
that we'll have to set that would deem, you know, a school be closed or maybe the entire district. But we've spoken over the week, you know, because pre-K and K kids aren't going to be wearing masks, and so contact tracing will look different in those classrooms. And I know you probably have questions about contact tracing, but yes, that will look different.
Okay. And then I had asked if there were any written resources. You sent me the link to this today. I printed it out. I didn't print it out for everybody. I don't know if we have this, but we can definitely forward the link. I can forward the link to everyone.
Great.
So is this pretty much what the written, whatever guidelines, and they're changing those, I'm sure.
Yes, this was interim as of June, so I'm sure these will be updated. And I've requested a flow chart from the Department for Public Health that would make exclusion easier, because a lot of pressure is going to be put onto our school nurses. And Kelly and I have been in constant communication, and actually we visited the health services area quite a few times to do assessments, but they're going to have increased amount of pressure of kids, you know, coming in with symptoms. And so if we could develop a flow chart to make that easier, I think that would be best practice.
Right, I agree. Like, as much as possible, because, you know, we don't want our school secretary to all of a sudden be presented with a kid with fever, and at that moment, we're in a case by case, and we're trying to figure out. So the more we can have, that's going to be so much better for our staff.
Definitely.
To know what's happening instead of, well, you know.
Well, and I think just to be clear, there are those protocols in place. It's coming from guidance from the state with the Healthy at Schools, and so the guidance will be in place. Like, our staff wouldn't have to make these decisions on their own. It wouldn't be anything of that nature. You guys have been working on this, and the task force has over the past few months. I did want to ask a question. I know that you can have links, and Bob puts links on things. Is the Healthy at School one of the links that we could add on there possibly?
We could certainly add that.
Yeah.
So folks can just kind of click on it. I mean, it's a lengthy document, like you said, but in listening to all the preparation and the answers and the task force meetings, it sounds like you guys have combed over this like with a fine-tooth comb.
Yes.
And then you've had meetings, and then you had collaboration, and then you put into place procedures and policies and things of that nature. And I do understand they change, and I'm appreciative of that fact. But thank you for all the work. I mean, it's remarkable, because that's a big document.
And I think if there are written protocols like Sherry referred to, you know, because some of the answers we've given our community and our parents is, well, you know, the health department will set those protocols. So instead of getting that answer, if there is already a written protocol in effect, we should give them that, you know, so they don't have to
Well, and I think
come to you too. They can get it from us.
with regard to the metric question, I do think that's a big thing for a lot of our parents. You know, is one child being positive in my kid's classroom going to require quarantine for the whole classroom, and especially for our pre-K and K kids, because they haven't had the protection of a mask. And then I think from Mr. Hawkins' perspective, are we going to look at school by school closures if that's needed versus whole district closures, which isn't probably something we've done in the past?
I mean, it could be a classroom.
Right.
Or it could be just 2 or 3 students. And that's the thing. And this is where I really appreciate Cassie. And I think we have to be very, very careful. They can't give us an answer for every scenario.
But they may be able to give us some for some scenarios, and as many as you can.
But their practice will be on the contact tracing. They will follow a set practice, and that is established. And that will be very, very clear.
And so that is somewhere we can, another written resource that we can refer people to.
Right, and I think actually Garrett read from that when we did our town hall.
Yeah.
So that was exactly what we have been provided, that they will go through a very specific process. And that's why we have to be a partner with them in terms of having seating charts and all of that. So we're able to provide that information so that they can make that determination. But again, and I know people want answers, but there are times when you can't say this will exactly happen.
That's right, yes.
It will be very much situation specific. And so we trust our folks, and we have a great relationship with the health department. And
Well,
we will
and
continue
Mr.
to work
Hawkins has
alongside
told us this, and I appreciate it. And it's, but again, because so much was referred to you, I thought it would just be helpful to hear, and for our parents watching, because a lot of the questions were referred to you. And if you say, listen, we can't, we don't have it, then that's going to go a long way too for everybody to totally understand that. But it does sound like there are protocols in place for, what was it we just talked about?
So actually, to your point, Ms. Bradley, a positive case in a pre-K or a K room could possibly lead to quarantine of the entire room. So the case is isolated and the class is quarantined. So if you're a contact of a positive case, if you're a contact of a positive case, you quarantine. And if you are ill in a positive case, you isolate. But the recommendation is to cohort them. So if you have a class of 20, then you separate them as much as you can in the classroom so that you wouldn't be quarantining an entire classroom. You can maybe do half. Now, an individual classroom of, let's say, for example, I have a fifth grader, so we'll use fifth grade as an example. With those scenarios, with those positive cases, they will have to meet the case definition of a contact. That is at less than 6 feet distance for more than 10 minutes. So that's how you meet that criteria. Now, that's if you're unmasked. So the mask changes everything.
And what is it with a mask?
With the mask, you're not a contact. If you know, so we have, cases in the county where, let's say in their place of employment, they've been working within 2 feet of someone else, but if they're both masked, we're not seeing those positive rates with their contact if they're masked.
And how would we handle on a case if we have a kiddo in one of those classes that has a sibling in another classroom?
So that would be an automatic contact. Any household contact is an automatic contact.
So if one of our kindergartners tested positive and had a third grade sibling, then their third grade sibling would automatically be quarantining for 14 days. Is that?
Yes.
Okay.
Yes.
And then does that then stop with the sibling because they're masked in the classroom?
Mm-hmm.
Okay.
Yeah. So if there's a degree of separation
to that whole third grade classroom.
Exactly.
Okay.
Yes.
And again, I think one of the things that we will do in our pre-K and K is the mask may not be required, but there may be a lot of parents who say, my child's going to wear a mask.
Yes.
And if they do, then that limits the risk of them being considered a contact in that room if there were to be a positive case.
Yes.
Okay, so, okay.
I don't want to ask any leading questions, so I want to tell you how I feel about this. I voted last week to have the dual system. I've changed my mind. I think the safest, beyond a shadow of a doubt, the safest thing for our children, our employees, and our community is to begin the season virtually. And one of the reasons I say that is I've talked with many employees who are so apprehensive, that have underlying conditions. I've talked to parents who are concerned about protocol, and as the superintendent has mentioned, there is no answers to these questions that we're talking about. There's none. And when we talk about these questions, we don't talk about if cases arise. We talk when cases arise. So to me, that should send off all kinds of red flags. However, if we go, talk to me about testing. Everything that I've read, everything that I've listened to, everything that I have heard is the key to a successful gathering of students is the quick, rapid availability of testing to where you can understand better who has it and who doesn't. Can you address that a little bit about Versailles, Midway, rapid testing?
That's a great point. And yes, that part of the piece of attacking this is the surveillance piece, and that is increased testing. We do have at least one location here. It's for Versailles Urgent Care where they offer rapid testing, so that's going to give you a result within 15 minutes. I've done that test. It was quick. It was efficient. And there are other places here in Versailles, but typically you have to be a patient of theirs. So if you need to be established somewhere else, again.
But we do not have the availability of mass rapid testing.
That is probably true. However, there are locations out of Versailles where folks can get tested, and actually the health department is looking into doing testing.
But right now, you know, for the parents and the employees who are listening, because there are many concerned folks about what's the right thing to do. And you know, if you look at the paper, if you read, testing is a problem.
It is, and a lot of folks actually seek healthcare outside of Woodford County, just as a general rule.
But I mean, like for instance, if there was an outbreak at Northside, it would be very difficult to get 300 students tested quickly and employees, wouldn't it?
It would be, yeah. I don't know of a scenario where that might exist, and there might be opportunities through the state to do mass testing. For example, now, if we have a positive case in a long-term care facility, then there's a healthcare infection acquired team that comes in and tests everybody. They do mass testing. That might be part of what the state steps in and does for schools. I'm not sure, but that's a great point. And we do need to be actively surveilling. And certainly it would be a concern if a family could not get testing or have access to testing. But hopefully the health department would be able to help out with that too.
But that's, you know, and I speak to the superintendent and other board members, you know, that should be a key component. And the superintendent made reference in his opening remarks, parents need to be ready for any changes. I can't imagine how you could open without the ability to have testing. You know, and I'm not talking about 4 of us go to the urgent care and 2 of us go to Kroger and Winchester or whatever. I'm talking about being able to test rapidly our students and employees. Another thing, watching the governor's remarks on TV, he talks a lot about younger children contracting. Today, I think he mentioned 18. One was an 11-day-old. Yesterday, Friday, I think he said something like 50, and there was a newborn. Can you talk a little bit about that?
We haven't seen a huge number of younger kids positive in Woodford County, I can say that. The majority of ours have been middle age, and they've been women. But I think the governor, he's proven that he's diligent. He's reporting on these numbers daily, and we're going to continue to monitor so that we can, if we need to make changes, we can do that quickly.
How many cases have there been under 18 in Woodford County?
I would have to look at our stats. We actually just had one reported today, and it won't be included on our report because it was received as I was walking out the door. But I can say that one was asymptomatic, and several of our child cases have been asymptomatic. They've been tested as a result of another household member testing positive.
That's such a great point what you just said, because there could be so many of our students just like that, who you wouldn't test normally, who could have it.
Right.
They give it to our employees, I'm of the understanding that middle and high school students may not show any ill effects from having COVID-19. They may not know they have it, but yet they can still carry it. Is that?
From the research that I've seen, if you are asymptomatic, you are not as likely to transmit it. But again, we're still learning, and that's where these masks come in.
Yeah.
Because even if you are asymptomatic, if you have on a mask, what you're breathing out and breathing in is going to be filtered. So that's why these are key. And I think from the beginning conversations before masks were mandated in the state or even in schools, we talked about, if we're going to be able to do this safely, it's either going to be at a very reduced capacity or masks.
And
I'm sorry.
I would echo Mr. Wilson's thoughts. I think the biggest thing is the safety of our students and staff. And we have heard, all of us, I'm sure, from staff members who are just completely scared. And like you said, there's so many variables in this that we're just learning as a nation, let alone as a county, on what works, what doesn't work, how it's transmitted, how it isn't, whether it's living on surfaces and things like that, right? Then I think it's a big risk to ask people to come back when we don't know more, and we're asking someone to expand their contacts just exponentially with their students, especially at our middle and high school level teachers. They interact with so many students a day that it's a bit overwhelming. I appreciate very much you coming, and hopefully we can move on to some of our
Yes.
other questions.
Let's get to our
Let
questions.
me ask a quick question
Sure.
just to follow up on that. What are our numbers in Woodford County, and have we had any problem with people getting tested? I've been tested a few times, and I've not had a problem at all. I had a daughter who tested last week, and we didn't have a problem getting her in. But I realized that maybe some areas are having some issues, and I know the governor announced today that Kroger was not going to be a site, so he was going to look for some partners. But just in Woodford County, like right now, I know businesses have opened up, restaurants, we've done, some healthy at work openings, those kinds of things. Have we had a problem with folks not being able to access testing?
Not that I'm aware of. We have folks that contact us, call us, or they send us messages on our Facebook page. We always send them the link to the KY COVID website, because there's a drop-down menu and you select the county and it will show you the testing sites that are available in that county. So, there have been some delays, I think, right now. For sales urgent care, you might have a few days that you would have to wait, but nonetheless, you can get that result once you get tested within 15 minutes. And right now, we have 115 cases here, but now some of those have recovered. I believe right now we actually have 21 that are still active or under surveillance.
Gotcha.
I think we've been lucky in Woodford. I absolutely agree. It's been amazing to me that being between Franklin and Lexington, it's not been worse. I know from people I've gotten tested, I know that people have had good luck with that. But when we open our schools, I just can't help but think, and please disagree with me, that is going to be a massive change in our community. That is going to be a massive gathering of people that we haven't experienced in the last 6 months. So I would expect the need for testing to go up. I would love it if we could test, like, for instance, when we gave the example, we have a Northsider, we have a third grader at Northside who's got COVID. Ideally, the schools and the public health department, are we going to be in a position to test every one of those other kids without their parents having to go out and find their own testing situation? Is that even a possibility? Like, and to test their teacher instead of them having to jump through the healthcare hoops in our country to get that done. I mean, is that anything that the governor or that anybody's thinking about as we open schools? Because the testing needs, especially Woodford County, I only have to assume are going to really rise.
It could potentially.
And we need to, as schools, to be able to facilitate that for our children so that we can operate more efficiently.
So with the classroom setup, those that meet that close contact criteria would need to be quarantined, and I'm sure parents are probably going to try to get them tested And we wouldn't recommend them getting tested until 5 to 7 days after their last exposure. Because when you test, you only know your results and your status for that day that you tested. So that's another thing to keep in mind, that if you.
So it's best to test, give it a few days before you test.
Yes, yes,
And I assume when you do your contact tracing, you talk to people about that.
yes.
Yeah.
So I can't see a situation where an entire third grade classroom would be quarantined. Now, if you have.
What about a kindergarten?
That could potentially happen.
Yeah.
And I'm not sure what the survey results were as far as how many folks were going to send their kids back to in person. And
About 65% right now.
But I don't know if we know that by grade, or we haven't.
We can break that down
Yeah.
by grade level.
Because
but
kindergarten is really kind of a different animal without that.
yes, I understand.
How does it work for the rest of the buildings when the kindergartners leave their classroom without masks?
Without masks. So the thought behind that is, all of the staff that they would be interacting with would have on masks. So that would be their protection and transmission.
And I'm positive you know more than I do about how long he's living on surfaces. Are you concerned about them going to the restrooms? And you know how little people touch everything that they come into contact with, the walls, the handrails. Is that a concern for then the next class coming behind them, the teachers coming behind them?
And I believe every school is going to increase their sanitization efforts. And I spoke with Mr. Wells a few days ago about a company coming in and sanitizing every night, just for an added step of protection there. And I've provided, we'll get into this in a few questions.
Yes.
But
We're
I've
kind of jumping
provided
around
the
it, yeah.
district with a list of all the EPA approved sanitizers. And some of those have different contact times.
Okay.
So again, it's a good reference document. It's actually referenced in here. So they know, they're aware, and they're using sanitizers that are effective against COVID.
Perfect. Thank you.
So I just want to make sure the only written protocols that are really available to look up right now were for quarantining, like you have to be 2 feet apart.
Yeah.
Okay.
Less than 2 feet apart.
And so I'll try to get links for those, and we can put those up on ours to help our parents understand those answers. And we talked about quarantining. The other part of quarantining I'm interested in, what are your guidelines? Are there any protocols when people leave the county or leave the state?
So right now that's a recommendation that folks quarantine.
So a recommendation is different than a mandate.
That's right.
Yeah. Okay.
And I would always advise testing too on return, just in case. Again, that's a recommendation, not a requirement.
And do you recommend them waiting that 5 to 7 incubation period to test after returning? Because that's been another often asked question. I know you've seen it too. Is
yes,
what happens with fall break?
Right. So
And
that's great.
if they come back that first Monday after fall break, but need to wait 5 days,
To get
Pose a
tested.
challenge. Yes.
Yeah.
It could,
for sure.
And then perhaps another 14-day quarantine.
perhaps.
So if you don't test, if you're not able to get a test within that 5 days, you still have 14-day quarantine.
And again, that's a recommendation. That would be a district decision if
Right.
they
Right.
wanted to enforce that or not.
And I think that's because I really think we need some outlines on that before
And by
school
that
starts.
time, the governor may
Have set
limit
forth.
those restrictions.
Yeah. What about enforcement of these kinds of things? Like, is that your job? Like,
So masks in the school, that's not, we're not the mask police. So we're your partner. We want to work with you all to create documents such as this, guidelines. But no, we're not the mask police, so we're not going to be enforcing anything like that.
what about the quarantine enforcement?
The quarantine, yes.
Okay.
So that would be with the parents of the child that has been deemed a contact. And there are guidelines and isolation orders. And again, this is nothing new. We've been using the same practice for years, measles months and things like that. I do want to recommend that if there's a positive case in a class, that regardless of contact, you want to make sure that you communicate that someone in the class was positive and that the parents need to remain vigilant for symptoms. And there are actually documents that are linked from this larger flagship document that can be referenced and used.
Templates, and, yeah, okay, so that's
And
up
that
to the
is not-
school, so that would be up to the school to, because I'm assuming if we get a positive case, we're gonna notify you. If you get a positive case, you're gonna notify us.
Typically what happens is the physician that ordered the test, the provider will contact the parent in this case, and then the parent would then either contact us or then soon after the provider will contact us.
So the provider does have an obligation to contact you in
Yes.
case the parent does not.
So this is considered an emerging infectious disease, which requires immediate reporting because it's time sensitive.
Okay, okay. So, and then once that notification happens, what kicks in is 14-day quarantine, contract trace, depending on, and then would you like come into the classroom and say like, how obedient have we been? How effective have we been with keeping people 2 feet apart, with masks for 10 minutes, you know, or they've been off?
So we'll work with Ms.
The
Thompson.
teachers. Okay,
Yes.
okay.
Can I do-
And then,
I'll wait. It's okay.
Debbie, I think.
so,
That's okay. Go ahead.
no, well, I'm just trying to, I really hope we leave here with what protocols are in writing and how we can refer them to our patients. So I'm trying to, or to our patients, to our parents.
It's also, I like the link I did, having documents and
Yes,
things so people can
yes.
see these
And
protocols.
some of
'Cause
these
you're not
questions-
making these up. These are state protocols and health department protocols. And so the more that we can kind of link and let people see that source and read that information, they'll know why we're doing what
Right.
we're doing.
So, and I think, you know, we all want answers. There will be case-by-case answers, but we all want as many, and if there are some protocols in place, we want those to be known.
And by and large, with other communicable diseases, we've always notified the entire classroom. And again, you know, less than 6 feet of distance for more than 10 minutes, that's very standard across the state, not just specific to Woodford County.
Mm-hmm.
And so, again, most people are going to know that, but if you can write that out and explain it in detail,
Yes.
that way people know what to expect.
Right, and this is the protocol.
Mhm.
It's not, yeah, so, and then I guess if parents, and this, I'm sure because you work with providers, health departments in the schools, there's no privacy here, you know, like, I mean, we don't worry about privacy considerations. If a child goes to their doctor and finds out if they're positive, the doctor has an obligation to report it to you.
Right.
You have an obligation to report it to Mr. Hawkins. And that's no matter where that would happen in the state.
So HIPAA still applies, but
Right,
it's a little bit loosened when you're
Right.
investigating.
right. It's not standing like this. And then if they got a positive test in Muhlenberg County, but they found out they went to school here. So it's all, I'm assuming, very coordinated across the state.
we transfer cases across county lines all the time.
Okay,
And especially with those that are contiguous. And so we have a good standing relationship with other local health departments. And again, a standardization of procedure is pretty normal.
okay. I think that was kind of it on quarantining. I mean, I know there was a lot of questions to you, like, how long do I have to stay out of school? Does my whole class have to be quarantined? So it sounds like there's some protocols in place that we can link to for these different scenarios. And we'll get those out. Okay. I think Mr. Wilson had a question.
I was made aware that one district is going to do what we did, parent choice for in class. And they're going to have classes on Monday and Tuesday, Thursday and Friday, Wednesday and Sunday. They do deep cleaning in every building so that no students will ever go more than 2 days without a deep cleaning. What are your thoughts on that?
The more cleaning, the better. And I actually was going to recommend too, if we do need to close a school for an increased number of cases, I think too, doing it on a Friday or a Monday is best so that you have extra time for cleaning and people to get well and things like that. So the guidance is actually pretty general in relation to cleaning and sanitizing. It just says increase. But again, this district has gone above the guidance
Okay.
and making
I mean,
sure
yeah,
those protocols are in place.
What we are pursuing is to contract with a company that would come in every night.
Okay.
Yes.
And so it would be far more than just Wednesdays and Sundays. that we would do disinfecting 5 nights a week.
Okay, good.
That's wonderful.
And kind of going back to the quarantine one more time, let me make sure. So do you have to have a negative COVID test before you come back?
So you can actually finish your quarantine in 2 different ways, and we're kind of getting into the weeds. But you can actually get out of quarantine early with 2 consecutive tests,
Okay.
24 hours apart. However, the time piece also applies. So if you go at least 14 days, and you have to be asymptomatic the last 2 days.
But you don't have to have another test if you go 14 days and you're asymptomatic. Okay.
So there are some healthcare workers and things like that we're able to, there are different guidelines for them. And so if you can test negative, two consecutive negative tests, then you can get an early release.
Okay. Well, and then I had some questions about cleaning, like what are the protocols? So it sounds like we're going to really hit it at night. What about during the day, especially in high school, middle school, where you change rooms? Are there any recommendations or protocols for that, like what to do in between classes?
So I think in the high school and places like that, you could actually have your students.
You think that's
pitch
adequate to have the students do it? Okay.
Depending on age, and I don't know if that's something that the district is planning on doing, but we did discuss that when we were doing assessments.
We're actually talking about middle and high both being able to do that.
And then, obviously, we know the strength of the cleaner we need, I'm sure.
Yes.
Yeah. Okay.
And I've had separate conversations with Miss Kathy Hogg about pre-K and how they're going to cohort and clean and things like that.
Okay. Because I don't know if they're planning to ever leave the room in pre-K.
They have to, I mean, they need some movement. They don't.
Yeah.
So.
And bathroom breaks.
And I think I know one thing the governor said, and I thought was great, and I think it would be, are we going to require, like, if our kids do move, even if they're pre-K or K, while they're moving outside the room, they can wear masks. We're not even going to require that.
They're not required to wear a mask.
But are they forbidden to wearing a mask?
No.
They can. My kindergartner will be in a mask.
Okay. All day.
Well,
Because I was just thinking, like,
breaks.
moving to the bathroom or going to those places where other kids, not just kindergartners, are frequenting.
And all kids can have mask breaks. They are inside the classroom and they're maintaining more than a 6 feet separation. They can take mask breaks. They can pull down their mask. If they want to go outside, they can pull down their mask. We encourage that.
Do they have to stay 6 feet apart outside?
As much as possible.
Yeah.
As much as possible.
Right. And so a mask break, we did actually have a question from someone that, like when you take your mask off, you're still spewing. And those aerosols that could live for hours. So after a mask break, should there be cleaning again, do you think? Or
If they're inside the classroom, that would be reasonable.
Okay. Are there any guidelines on what types? That was another question. Does it matter?
Multiple layers is unless it's a surgical, which is typically, well, actually these are 2 layers, but if they're cloth masks, it just specifies that they need to be multiple layers.
Okay. And we've been told, Mr. Hawkins, is that still the rule? No plexiglass shields, even for our teachers?
We are actually going to order plexiglass for our K and preschool teachers. So
Okay.
they'll have a mask
Of sorts.
and a plexiglass.
Okay.
And, but the plexiglass does not replace the mask for students.
And that's a guideline from the state.
And we just always look to make sure that there are no sharp edges.
That is correct.
Okay.
Did you have a question?
On that, I thought that they had shied away from plexiglass kind of cubicles for fear of them being a safety hazard. Because I thought that question actually had been asked to Dr. White, and that she had said,
We don't plan on putting them on the classroom tables.
or in the cafeteria.
We are going to have to put them in the cafeteria if we're going to try to have kids. Now, they're going to be Velcroed down and they'll be in the middle of the table if we do that. And again, that's something that we are considering. Otherwise, we'd probably be eating lunch for a really, really long time. And this allows us to set students on both sides of the table because there will be a plexiglass piece in the middle.
So that is new since the last time we met.
That's just something that we've been exploring. And again, Cassie has kind of walked around with us in the cafeteria in order to try to do that. Now, again, kids are going to be, they have to reach out,
Yeah.
hit it pretty hard to knock it down. I mean, they're going to be sitting, it's going to be far away from them. It'll be on the end of the table so that, again, you're trying to avoid as much contact as you can. Kids will be 6 feet apart on the table. Again, we are trying to do our best to meet every guideline that is out there.
Ms. Prather, I'm so glad that God led you to Woodford County, using your words, because I think you're going to be an integral instrument in the welfare of everyone in the county. I applaud the superintendent. I applaud his staff, his Symptom. I applaud your staff. And I know in my heart that we will follow every protocol that we know to make sure that our students and staff are safe. But it sounds like to me from our discussions this evening that once school starts, it goes from being proactive to reactive. What do we do when it hits here, when it hits here, when it hits here? Quite frankly, I'm more convinced now, but when I sit down here, that the best thing to do is start virtual.
Now, I would just say this. I think every day that we go to school, we will be proactive. That's why we're going to be taking temperatures as they get on the bus, as they come into school. That's why we will continue to clean and hand sanitize and clean every night. Those are all proactive steps that we're going to require masks. But there will be times that we will have to be reactive if there's a positive case, just like we have to be reactive if there's a case of measles or if there is a case of something else within our schools. There will never be a time that we won't be reactive.
But Scott, I said we were being very proactive. I said you were doing everything you could do, but Ms. Prather's doing everything she can do. This is not measles.
I understand that.
This is not mumps.
The flu. Yeah.
This is not the flu. It's not.
I didn't say it was.
No.
But you said once we start school, we will just be reactive.
No,
and I don't believe that's the case.
Then we begin to have to be reactive. When you mentioned in a third grade, like if a third grader gets it, and I don't want that to ever happen to a third grader, but if a third grader gets it, you say we have to notify other children's parents in the room. But if they rode the bus, you've got to track down everybody they rode the bus with. If they, it's very, very difficult.
It's a lot.
It's scary. I mean, it's just scary. I will say I watched the Lieutenant Governor's town hall last week, and I think if we could have a link to that would be wonderful. It had a lot of great information.
Yes.
And it was clear about, it's not everybody, in the third grade room. It's literally only the people that meet the definition and that you shared earlier. And I think it's reassuring to have more information, is reassuring. But I will say, I think that, safety-wise and just, rates of infection, I do believe that, there's just a certain point where the governor has been very proactive throughout this entire process. And so, if numbers are such in the state, he's going to ask, like he did, for us to delay things or for us to close things or for us to do things. And I appreciate that we have the local control now. I appreciate that we are planning, for the best so that we have options for our families. But I think we all realize, if the numbers are, 15% or higher, obviously they're probably going to shut us down, right? It's not going to be even a local thing. But I do appreciate, I think that I have a lot of confidence in how Woodford County is going to be able to do with school opening based on what Woodford County Health Department and you guys have been able to do thus far with work opening back up, with things opening back up. And I appreciate that the governor's been able to take some steps back and to implement some things. So I understand that it's very fluid, but I am, like you said, Ambrose, very thankful to be in a district where the partnerships and the people, clearly it's all about safety and all about, doing this the best way that we can possibly do it if we're allowed to do it. And if we're not, we understand,
I think the chief difference there is waiting for the governor to say we can't do it and making that choice at the best time that allows for our staff to prepare for the best virtual instruction we can develop is the biggest factor. I think if we all acknowledge, and with the message from the commissioner today and the message from the governor, I think everyone thinks we're heading for virtual instruction. Is it better to just go ahead and decide that now so that we have time to prepare, or is it better to scramble a week before school starts when the governor tells us that?
What we're doing now is preparing for virtual. I mean, that is what we're doing now. We're preparing 2 different ways of doing it, 2 options. So I don't think we would be scrambling at all. When I went to the task force meeting, it was clear that these protocols are for virtual learning and for in-person learning. That what they were doing was coming up with ways of being able to meet the needs of the special populations both ways. It wasn't one or the other. We weren't just going to be doing one and not the other. But I do think that we have, you said 21 active cases in Woodford County. And I do think 21 it's a scary number. It's scary to have any active cases. But, basically in the town hall that I went to, the lieutenant governor and the education staff made it clear that, there's some risk involved, and that what you're doing with the protocols is you're reducing the risk down to a level where people can then decide, is that an acceptable level of risk for me? They said the only way that you could be 100% safe was that if you did not have contact with anyone, period. So you would have to be at home, not getting groceries, not having any kind of contact whatsoever with anyone would be the only 100% safe thing. And that what these protocols and these recommendations and these, mask wearing, the PPE, all of the things that are the healthy at school guidelines are doing is trying to reduce that risk to an acceptable level. At least that's what I took away from the town hall.
Okay. And let's try to ask Ms. Prather. I asked her to come here to answer questions. These are debates and different things that we'll be having as we go forward and make decisions. But let's try to get our questions answered from her. Is that right? Yay! Okay. One thing that you just brought up, and again, this is something I hope we have in a written policy, a protocol, because I think parents are very interested in, is notification. So my understanding when we talked earlier was that we would notify everybody in the classroom, including the teacher. But I might have misunderstood when you were answering Sherry, or Sherry was saying something that we would only notify people who were within 6 feet of that kid or 2 feet of the kid. We're going to notify the whole class.
Right. And then with the manifests and the seating charts that we're given, whether the kid rode the bus,
yes,
where the kids
in cafeteria
or in the classroom,
yeah,
we're going to use all that information, and I'm sure we'll be working closely with Ms. Simpson and in determining who meets the close contact criteria.
That's in addition, but automatically we're telling everyone in the class whether they meet those closeness things. I just want to be clear.
So you get the notification letter if there's someone in the class, but you don't have to actually test unless you meet the criteria to test.
Well, and you may get a notification letter even if you're not in the class, if you sat by them on the bus or whatever. Okay,
yes.
I just want to clarify that. And that's something that if we can get that written out for parents, because they want to know, how am I going to know? The more that we can kind of give a little bit more substance and guidance, the better. One thing, and I saw this on the student, or on the staff, the new survey that, my glasses will not stay on with my mask. I'm sorry. They were worried about PPE. So other than masks, is there a recommendation or protocol of other PPE our staff should be wearing? Gloves, nothing else?
It depends on what they're doing. And, we want to also keep in mind our custodial staff that are going to be going above and beyond.
Yes.
And probably be more so a threat, or be more threatened by cleaning up things. So we want to make sure we have gloves and masks for them. And then for the healthcare folks, they might go by the way of gown and then a face shield too. So a face shield can be used to augment or add to the mask, but you just can't use it in lieu of the mask.
Okay,
Yes.
but so far as PPE for teachers, instructional aides, pretty much the masks. Obviously, if they want to wear gloves, we could provide those. And
They just have to make sure to change them in and out. I think a lot of people
yes, they need to
have a
some
false
very,
sense of protection with gloves.
security with that. Okay.
And
I know that was something that they worried about was PPE. I think they're also worried about cleaning supplies, having those. But
Miss Simpson, I believe she's been ordering all summer
okay,
to procure
And
the
we
amount needed.
and we'll ask her and Mr. Hawkins. One of the questions was like, how many months do we have in stock now? Because that could be. Another question is social distancing. This is just something I've been confused on. If you social distance 6 feet and you can guarantee your kids are 6 feet apart, do you have to wear masks?
You can pull the mask down. If you're coughing, you can actually project those droplets more than 6 feet.
Yes.
You can go about 8 feet. But if they are more than 6 feet apart, they can bring their masks down.
Okay. But then
Any closer, masks go up.
probably wipe down wherever you were, whenever you've taken your mask down. Don't wait for the in-between class. Okay.
And I think there's some signage and different things, like the town hall they were saying, to kind of show the kids so they talk to them about that kind of stuff. This is.
So we're marking our rooms, we're marking our.
There are lots of graphics in this document that will be very
And that's what you gave me the link for. Okay.
Yes.
And we're actually going to print out the posters from the CDC that are decent, and we're going to laminate those, so we'll be putting those up in the schools as well.
And then they'll change.
This person, you said that if your mask on, you can project 6 feet, 8 feet. I'm sure if you're screening 10 feet, how long does if you're infectious, how long does that stay on surfaces?
At first, they thought it was up to a week, and now they're saying hours. But again, I think that's why we're taking the measures to make sure things are wiped down more frequently.
It seems like after any mask break, there has to be wipe downs.
But theoretically, if I take my mask off, I holler Miss Bradley, projectile, infectious, whatever you call it, hits that table. Somebody comes up within 2 hours, they can contract.
If they touch it and they touch one of their mucous membranes, you're odd.
Because I knew that the science had changed about weeks to, I didn't know exactly, so it's a couple hours.
Yes, and I know there was a scare with deliveries, postal system, Amazon, things like that. And I think as we're learning more, we've learned that it does not stay on surfaces or remain alive. And it especially does not like being outdoors. Mm-hmm. And the more ventilation you can provide inside the classroom,
and
HVAC
that's what I want to get to today. That's one of my questions.
So it likes stagnation.
That's good information. Thank you.
So basically, if we can't provide social distancing, we just have to wear a mask.
Yes.
And if you can't provide social distancing because you've got too many kids in a classroom, there's really not an opportunity for a mask break in that classroom.
Or you can go outside to a covered area or to a area like this.
Or to the gym or something, Okay.
Are you recommending a minimum, for a minimum distance within the classrooms, or is there a recommendation from the state?
So, of course, it's going to be 6 feet. That's the recommendation, but we also know that there's no possible way that you can achieve that, especially if you have 70% of the kids coming into the building. So maybe every other seat be available, every other bus seat be available. We're going to have to create.
But always with masks.
Yes.
Yeah, but still try to get as much social distancing.
Can I ask a follow-up question, please? We'll probably have 2,200 students come to school.
Minimum.
Continue on the path of the surveys that the superintendent shared with us. What's the percentage of those students that will not wear a mask, not have to wear a mask because of other health conditions that they may have? What do you think that percentage will be?
I hope it's low. I hope it's low because if you have asthma, then you absolutely need to wear a mask. It's not going to restrict the airflow that much.
But there could be some folks that,
There could be, they can get a note from a medical professional, that states that they do not have to wear a mask. But if it's that much of a risk, we might need to take a look at, virtual learning for that particular child.
Yeah,
Because they could have an underlying.
Conversations with Graham and even Dr. White on last week's webcast said those situations should be very rare.
Right.
In terms of the students that would be exempt.
but if they're rare is rare, but if it's your child, it's not rare. So those, you would recommend that those children do not attend class?
That would be up to a medical professional technically, and I hope that the parents of those kids are consulting with their pediatricians on what would be the best plan.
Do we have a protocol for that, Scott?
Those students are probably going to be extremely medically fragile, and we will be working with people within those classrooms if that were to be the case. So yes, we would be having conversations with those parents and those families individually if that were to be the situation.
But so what if, we can have conversations, but people are going to come out differently. So what if there's a kid, their parents feel like they're fine in school, they just can't wear a mask, and their doctor agrees they should not wear a mask all day? Are we going to have a protocol that they need to be 6 feet from all other students?
That would be my recommendation. I think
Yes.
possibly a district policy.
Yeah.
Those children would be required to social distance.
So if they're not going to wear a mask and they have a medical note, but they're still going to come to school, they need to be 6 feet from all other students during the entire day. Okay.
And if it's a child that's asthmatic and they're managing their meds properly, they should have there would be no reason why they couldn't wear the mask.
I think there's going to be a lot of different conditions that are asked for an exemption other than asthma.
Sensory.
Yeah, I think so. And I do agree that having a rule in place on how to best handle that is probably a good idea.
Because our parents, they're going to understand that kids have different problems, but on the other hand, they're sending their kids to school under the impression that we're putting in the best safety, and the best safety is mask. And if there's going to be one kid in there without a mask, they need to be 6 feet apart.
Well, and I was watching a different county board meeting, and they mentioned that there was a doctor in their community who would give a waiver to anyone who asked.
Yeah, and see, that's what I was just thinking too. There's going to be doctor shopping.
That's terrifying.
Yeah.
That is. Because then that undoes all of the good things that we have done to try and make things as safe as possible. And it will be a ripple effect. Like Debbie said, if we put 900 students in this high school, allowing for the number that attend virtually, it's going to be the biggest gathering in Woodford County since March. And it's going to cause ripples within the community.
Right.
If we have 30 kids that aren't wearing a mask because their doctor said they don't have to.
And I just think, well, it doesn't matter what I think. You're the expert here. We're asking you questions. Okay. Kids are going to get sick with other things. So I don't know. I have a sister-in-law who's a secretary in the elementary school. I'm not sure that a day goes by that somebody's not down there with something, right? And it's not going to be COVID. So I'm not sure what our protocols are for those. Are we going to send, obviously the kid's sick at all. We need to isolate them probably even more than we tried to before because we're in a new era of sickness and disease here. What is the recommendation until we know? Like even if they're just throwing up, which isn't necessarily one of the symptoms generally, it's my understanding. So what kind of things do you recommend? Yeah, I know it can be.
It can be.
Right.
So coughing, nausea, vomiting, diarrhea, fever, those are all the common symptoms. And if the child has any or all of the above, they do need to be isolated and sent home. Now, not every child will be required to test to return to school. And they need to be symptom-free, fever-free for at least 72 hours before they return. And again, we've worked diligently to create isolation spaces in each
Okay,
school.
so we do have isolation spaces in each school. Yeah, I would love to.
Even if they have the same symptoms, they're going to be separately isolated with a room that has extra ventilation. So we have to take extra measures.
So even, let me just make sure I understand. So if a child comes with a headache, are we going to call their parent or?
That would be a district decision.
I mean, if they need
Would
to
that
go
be a
home, I mean, we would treat that like we would normally. I mean, that's the.
But if it's a symptom, I don't know, is a headache a common symptom? Yes. It seems like anything could be a symptom of COVID.
That's the thing.
So I think as a public health director, what is your recommendation to us if we have, just to be really cautious, would it be to call any parent and isolate that child, but not necessarily make them quarantine or get a test?
Right. They're not required to test.
So if they have, I mean, I guess you could get over COVID symptoms in a few days, right? But still be asymptomatic and pass it on? Is that true?
You could.
So why would we, but you're not recommending they have a negative test before they come back?
There are so many other childhood illnesses that mimic COVID, strep, flu, things like that. And just because a child has one or more of those symptoms, it might not be COVID, but at least we would have that 72 hours after they've been symptom-free that would buffer sending them back to school.
Which is a big change from our normal.
Mm-hmm.
Normally it's 24 hours.
Right, but I was just thinking after 72 hours, they may be not symptomatic, but they could still be contagious with COVID. I don't know if that's true or not.
That's actually one of the isolation rules too, or release from quarantine. You have to be symptom-free for the end of that in order to be released.
For 72 hours. Okay.
I was just going to ask, I know you guys have been working really closely with the nurses and with Kelly. Will we prepare a document to send home to folks saying these are kind of the symptoms and, don't send your child to school, or you may want to consider kind of, just kind of educational kind of piece there? Is that something y'all are working on or you have already?
We actually talked about that today.
Oh, wonderful.
Sending that home.
There's one in this document, links to the CDC.
Perfect. And then, we would ask parents to sign off that if their children have these symptoms, that they would keep their child home.
Well, that's wonderful because it's just educational too. Because we hear different things and see different things and things change. But as a parent, to have that document coming home, this is what to kind of be on the lookout for. And then sign that you won't send your kid to school and then send that back in. I just think that's that's very valuable. So thank you.
Yeah, I think it's valuable in letting people know, because what we hear in the media, it's really respiratory. That's what we first heard. Mm-hmm. That's what's stuck in our mind.
I'm sorry, what were you going to say?
Nauseousness and stuff like that can also be it, where parents may not think it is.
There are a lot of symptoms, and I just hope that after all this, if we've learned anything, we learn to be more vigilant. Mm-hmm. And if we're not feeling well, to stay at home and wash your hands. Yes.
And then we're going to test the kids coming into the building for temperature.
Or on the bus.
On the bus. Would it be a recommendation to test them at lunch or something?
I think that's part of the plan.
We have that plan, yeah.
Okay, good. Because we do have people who put Tylenol on.
Right.
And I guess this is probably going to be more of a district thing, and really than you. Obviously, if a child gets on a bus with a fever, we're going to have to figure out what to do with them.
We're going to try to isolate them, and once they get to school, on the bus as best we can, and then once they get to school, then we will send them directly to the nurse.
And so going back to the notification, we're only going to notify if there's a positive test.
Right.
Not if there's, okay.
We'd be sending 15 letters home a day.
Well, now, your mother has it. Susie's mother has it. Susie's been in class with you. We're not going to notify the class.
No, there's a degree.
Are we going to quarantine Susie?
Yes.
Okay.
She would be, if she's a household contact, then she would automatically fall under the close contact.
Okay. But even if she weren't at school, she would have to quarantine.
That's exactly
right.
So
right.
Those are just kind of established safety.
And will we be notified that Susie's mother has it?
So what is my guess as to what will happen is Susie will contact the school and she will show the isolation orders. Is Susie the student or the mother?
Susie's the student.
Okay.
Her mother has it.
Her mother will
So
contact
Susie needs to quarantine because her mother has it. And we'll be notified, even though it's not our student or our employee.
So if it's your student that's been quarantined, my assumption is they'll have to show that isolation order or that letter from us that they've signed, recognizing that they understand what's expected during quarantine. And I would think that that would be.
But that's not something you would share with us directly. It would have to come through the
It
parent.
would come through the parent.
So if they don't show it because they want Susie to go to school, they don't want her home, then she's not going to be really quarantined from school because, right? Because there's no direct notification from you to the school that this child should be quarantined.
Yeah,
Is that
they're
right?
expected to share that information.
Okay.
But, if Susie's listed as a household contact and Susie is 7 years old, okay, what school does she attend? They're going to be, it's a CDC questionnaire and it's very lengthy, very thorough. So that would be captured, and I'm sure those questions would be answered during that initial investigation interview.
And, we have great parents, but you know what I mean? Like, the more direct notification we have between us and you, the better, I think.
Right. So since Susie is a contact, not a case, HIPAA would probably safeguard Susie's mother from us contacting.
Okay.
But we can cross that bridge when we get there. We run into a situation.
Well, we may not know that it's a bridge to cross if Susie's sitting in class and we have no idea her mother's sick.
If she's reported, though, if Susie's mother has reported that she's in classroom or if she's attending school, that might be an extra follow-up question that we would need to ask.
Yeah. Okay. All right. Only one. And then we talked about ventilation, and this did come up actually in our town hall. And you told me you were attending a ventilation seminar when we spoke or something on HVAC. Obviously, you've talked about it. The more we can go outside, and I think our staff is working on that. Hopefully, when the temperatures become more temperate, we can even have classes outside. Take advantage of that because we do have pretty, by and large, great outdoor spaces around our schools. What about HVAC systems? Like somebody had written in a question that there's industrial hygiene testing been done to determine the air quality. They wanted to know that. What is that? Is that something your office?
So that's not something that our office does as of yet.
Right.
But I think that the schools. Did you tell me that you all had contacted someone to come in and?
If there's ever a concern, we do contract with a company to come in and do air quality testing. Again, we haven't necessarily had the need to do that. Our buildings haven't been in use for the last 5 months.
Well, I think that would be a proactive thing that we would need to do.
Well, we can certainly take a look at that. As far as the HVAC piece, I have reached out to our contractor. There's a lot they still don't know in terms of what works, what doesn't work. You read and put in UV lights, but UV lights have to be replaced every year. They may not work in certain systems. We've been doing some checking. It's what we've seen right now. It's if you're going to put something in and I don't know that there's a guarantee that it would work. It's about $400 per unit, and we have about 400 classrooms.
But just to get our air quality tested in the first place, like our ventilation systems, we have varying ages of buildings. What is it that you learned or what you think about ventilation in this whole COVID?
Anytime that you can open windows and doors is best.
Okay.
As much as you can get the kids outside, even better.
Okay.
Again, COVID, any kind of coronavirus is not like the outdoor. You're not going to transmit it as easily outdoors. And then just making sure, which I'm sure you all already do this at each school, the custodians, I'm sure, change out the vents and just making sure that they're being cautious when they're doing that. enclosing those vents as soon as they get them out of the system and replacing those with the thickest, and most filtration that they can possibly achieve. And keeping the system going too is another good thing, and not letting the air get stagnant.
I was going to ask that. Do we need to keep them?
Yes.
I'm sure that sometimes
We usually do setbacks in the evenings, and we'll probably have to not do that nearly as much.
Yes, keeping those systems, the air flowing as much as possible. And again, anytime you can, opening up the windows. And I know that's a change because in years
We
past.
have different concerns about opening windows and doors, right? So,
Yes. But a fan blowing is also positive.
so you wouldn't recommend that we have our air quality tested per se?
I think it's always a good idea to have that tested, but I'm just saying from what I've learned, as long as they are changing the filters out in the systems that have been approved for the buildings, because they would have been approved when you built, and then if they've been replaced, so changing out those filters and then making sure that as many classrooms as possible, we're opening up the windows, keeping the doors open, keeping the natural air flowing is going to work to our benefit and our students and staff benefit as well.
And I'm not sure all our classrooms have outdoor windows, so we'll have to.
Well, and we can't, unfortunately, keep our doors open.
Well, we have safety concerns about keeping doors open, but there may have to be compromises. I mean,
That's in state law.
Well, that may be something we need to, because, we've got dueling dangers here. Okay.
So fans are good.
Fans are good. Yes. Keep the air flowing. Yes.
That's good to know. I didn't know because, like, the hand dryers are a risk. So I didn't know if it was any circulated air or
So the thought behind that is, once you wash your hands, you hope that you reduce the viral load. But if you haven't, and you've been unsuccessful in doing that, and then you're going to put your hand underneath the dryer, that's then going to propel the virus back into your face.
Okay.
Yes.
Okay. So paper towels are best?
Yes.
And is there a certain quality of paper towel or any kind of we have the thin brown, but any paper towel is
As long
fine?
as it dries.
Okay.
And hopefully it goes in the trash can.
Yeah.
After it's used to open the door.
So in lieu of being able to open the doors, Scott, can we look at a fan for each classroom?
We can certainly buy box fans. The only thing I don't know is how much if it does as much good if the door is not open. But,
Right.
I mean, if we need to buy box fans, we'll go buy box fans.
Yes.
No
We'll
problem.
see what the real benefit of that is at the door. Again, if there's nothing to push through with the fan, you're basically, like if they say in an airplane, you're just circulating the same stuff.
So maybe if a window is not an option, that might be an alternative.
Okay.
So we talked about if there's a positive case in school, contract tracing, and this is something that I think I kind of want to talk about a little later. We have students and employees who live in other counties. So that coordination, if somebody goes to basketball practice in Fayette County at a Little League game, but they go to school here, is that all pretty seamless in your experience? How are we going to, know that? And all right.
If they're identified, as a case in another county, or we have contacts of other cases that live in our county, we keep a good open line of communication with our other health departments.
Okay.
And investigating.
And then the last thing I had, and I feel like I'm the only one asking questions, so everybody open up. You talked about isolation rooms. I know that was a recommendation. So your understanding, you've walked through our buildings. We have isolation. Do they have to have bathrooms? Was that the governor's? Okay. And the isolation room, the purpose of it is to keep somebody until their parents come?
Correct.
Can we keep more than one child in there?
Some of them do. You'll be able to put multiple children in there. There'll be dividers.
Okay. And then as far as hand washing, I don't know if you tested how well you looked at our buildings. Like I know, for instance, in this building, there's limited hot water. You basically have to run a faucet for 60 seconds before the hot water kicks in. And that's only in some of them.
Right.
Some of them have the push? I mean, are there things like that that you notice that we should be trying to change in our facilities to make
You'd
hand
have to
washing
change the
better?
plumbing to do that. You'd have to change the plumbing.
Or change the faucet type?
That's the amount of time that it takes the hot water to get
Right,
from the hot
right.
water
I
heater
think that's
to the
just,
faucet.
yeah, and that's
That's
just,
the building. And we see that in older buildings and a lot of times in schools in general, even the newer ones.
yeah.
Because the hot water heater might not be right beside that bathroom. I can tell you this. Yes, we recommend warm or hot water to wash your hands, but technically if the water was hot enough to kill any bacteria or viruses on your hands, it would actually burn your hands. So if you're using soap and you're scrubbing for at least 20 seconds and you're rinsing.
The hot water is secondary. Okay, that's good to know. And then the other thing was just, so I guess that doesn't matter because we have some of the push.
Right.
I mean, everybody has to talk. We have some, I guess, buildings with sensors, but a lot that don't. Okay. What else? Have you noticed anything else that we haven't talked about that you think we should be thinking about or implementing or?
No, I mean, everything that we've recommended has been done. You know, this is certainly not the first conversation we've had.
Oh, sure.
So just appreciate ongoing communication and partnership with Woodford County Public Schools.
Yeah, and again, I'll try to make notes of things that we can actually answer for people and get out there, maybe even in a frequently asked question that were answered in our partnership, you know, with you and us, because I think we have learned some, like notification, who's going to be quarantined,
Yes.
just those kinds of things. I think people are dying to know, and it seems like we've gotten a little bit more guidance on that tonight that we can publicize.
Thanks.
Does anybody else have any more questions?
I know this is not easy to come and stand and do. We really appreciate your expertise, your time, and your
Thank you very
dedication to
much.
Woodford County.
It's been very informative. Thank you.
And I do agree. I think when school's open, we'll see a new Woodford. I mean, it's, you know, it's going to be a big thing for everybody. So
Will be different, and I'm sure there are going to be policies and things that are going to change as we go.
Yes.
Because
We
we
can
always
know better, we do better.
Absolutely.
Thank you for all your pre-work. We really do appreciate it because I don't think we would be in a position of having two options if, you know, the schools and the partnership with the health department hadn't started, you know, months and months ago. And so I think that just that planning has put us in a really great position. And, you know, it's clear the level of expertise and, you know, the preparation between you and the schools is just, it's really amazing. So thank you all.
it's great to always put a name with a face because I've been hearing a lot about you. You got a big job in Woodford County now, right?
Well, please share the documents with the rest
Yes,
of the
I
board.
will.
If you
We'll get them
have
up on
any-
link. I might, some of these answers, put them by you before we put those up. As far as frequently asked questions, make sure I got them like you. But anytime we can, again, give a little bit more specific answer to our parents, the anxiety level is going to go down. And that's a large part of all of this is anxiety. So.
I understand that.
Okay.
I'm
Thank
7'5".
Do you have any questions for us? Do you have any desires or anything you need from us?
No, I just want to commend Mr. Hawkins, Mr. Wells, Ms. Simpson, Ms. Quire, Ms. Hogg. I mean, they have all been accessible, available, and I hope that I have been to them too.
Mhm.
But again, just like Ms. Springate spoke of,
This will be the most important partnership we've ever had.
it will. And because that relationship was already there.
So, yeah.
So
That's
I'm very
great.
thankful for that. I'm thankful that my kids go to school here.
Oh, good, good. So if you notice anything in the school, you'll have to, you know, some parents see things that we don't, so.
Well, our role is education, not as much enforcement.
Yeah.
Anytime there's an opportunity for some education, we'll be there.
Who is the enforcer? And
That's
some of this-
Barrett Sheck.
Barry
That's
Sheck?
Barrett Sheck, but he's also an educator.
Yeah, with this new 25% restaurant thing, does he enforce those kinds of things too?
He does, or the labor cabinets who some of those those complaints go to. But yes, again, we're all educators at the health department,
Okay.
whether we're providing vaccine or whatnot.
Okay.
And we hope that's the next
So if
conversation.
we have someone to turn it with. All right, thank you, Cassie. You're
Thank
welcome
you so
to
much.
stay,
Thank you,
or
Cassie.
we can go on.
Thank you very much.
Stay safe.
Good. All right. The next thing is the treasurer's report.
I did have a quick question about that.
Can we go through it too?
Sure. Is Ms. Smith here?
I think so.
Mr. Hawkins, you can do that.
Or did you want to specifically go through?
I just think.
Well, Sherry had a question.
Go ahead.
I just had a question about, we had some information in the last meeting, and in reviewing the attachments and then a follow-up email that Ms. Smith sent, my question is just, what is the difference between our expenditures and our revenue for this fiscal year that just ended?
Okay. According to the annual financial report that was submitted to the Department of Education, that's required to be submitted every July. Our expenditures exceeded our revenues by approximately $145,000.
Okay, so that's $145,000 more in expenses than in revenue.
According to the annual financial report, yes.
Okay.
And that's with the post, because she had said something that she had some post, after end year transactions.
They were booked prior to June 30th.
But that's kind of the final. That's before after her. Okay.
So this is the last final number. It's been submitted. Expenditures exceeded revenues by $145,000. And then in just looking at the attachment she sent, it looked like our beginning balance in 2018 was $8.6 million for general fund.
That was in August.
I think that was in August.
Yeah.
So that was a couple of months in.
So August 2018, it was 8.6. And then this fiscal year that just ended in 2020, it's down to 7 million, around 7 million.
That is correct.
So that's a difference of 1.6 million down.
That is correct.
Okay.
I had a quick question too, and I'll let Danny ask. And I think she just might have, I know Danny had asked for 23 months. So she provided 2. She said they're uploaded to the KSVA website. Did she maybe?
No.
They go to the
To ours,
KSVA?
we post. It's posted on this every month.
Oh, okay. I thought there was more. Okay. Danny?
No, that's fine. That was, without Ms. Smith here, I was going to just go through it like we normally do. I think that's helpful each month, and we all think of questions as we go through it. Just wanted to do that if possible.
Well, and I do think it's important because we're fixing to set tax rates. And so for us to understand how we actually ended the year, that was in fact a deficit. And then the other point that I would have is that we would have been about $200,000 to the good if we unrestricted the $350 we have restricted for the general fund.
Mercy.
Yes.
Mercy. Nothing. Just say mercy.
Well, I think it's important that when we're going into the tax hearing that we're aware of where we are expenditure-wise and income-wise and, you know, why we're in the situation we're in and what options that means. Because, you know, clearly I think that, you know, if we have the money to run our schools and to do our programs and to, you know, pay our staff, that's a different conversation when you set the tax rate than, you know, if you're, you know, deficit spending because you're spending that on programs and teachers. It's different if you're just setting it aside and saving it. So I just want to be clear what the number was in the final email that was sent. Thank you.
Any further questions? Do we have a motion to accept the treasurer's report?
So moved.
Thank you. Do we have a second? I'll second it. All in favor of accepting the treasurer's report, say aye.
Aye.
All opposed? Okay, motion passes 4-0. Do we have any public comment, Mrs. Bailey?
Just 2.
Okay.
Okay. This first one is from Sarah McCallum. I would like to thank the board for supporting the task force recommendation to provide 2 options for our kids to return to school. COVID-19 has caused a great deal of uncertainty and anxiety for many of us. University of Kentucky President Eli Capilouto shared a quote recently that said, "We have 2 choices. We can go into lockdowns and shutdowns, or we can try to live in a COVID world." Additionally, the CDC has advised that the unique and critical role that schools play makes them a priority for opening and remaining open, enabling students to receive both academic instruction and support, as well as critical services. While none of us have any idea how long this threat will remain, I'm asking the board to continue to support the task force
and to commit to learning to live in a COVID world. I fear that another shutdown of our schools would cause significant damage both academically and emotionally. Respectfully submitted, Sarah McConnell. The second one is from David Graves. Hello, my name is David Graves. I'm currently a Woodford County High School science teacher, the president of the Woodford County Education Association, and president of KEA Central District. Over the past month, teachers have contacted me about a survey that was given by WCPS. The teachers expressed concerns over the wording and vagueness of the questions. After these conversations, I conducted a survey that was specific to teacher concerns regarding the upcoming school year. The survey ran from July 17th, which was a Friday, until July 24th, which was also a Friday, with 199 respondents. I sent the survey to all WCHS staff. I also sent the survey to all KEA members in the school district, and I asked them to forward to everyone in their building, due to the fact that I am not allowed to send emails to the entire school district. I sent a follow-up reminder email on Tuesday, July 21st. The results show the various concerns teachers have regarding their return to school. That's it.
Thank you, Elaine.
Sure.
Okay, next from the consent agenda, I'm going to ask that item H be pulled from the consent agenda before we approve it. So are there any others that want to remove items from the consent agenda before we vote?
No.
Okay, do we have a motion to accept the consent agenda except for item H?
So moved.
We have a second?
Second.
Have a motion by Mr. Wilson and a second by Ms. Springate. All in favor say aye.
Aye.
All opposed? Okay, motion passes 4-0. Item H is something I just want to talk about before we vote on it. I know this is a very standard thing we do, but it's approved non-resident contracts. What were the contracts on this were for which counties?
Jessamine.
Just Jessamine?
Was it Jessamine?
Bullet.
Boyle.
Boyle. I was going to say, wow, Bullet. Okay. Boyle and Jessamine, or just Boyle?
Just one.
Just Boyle. We do this routinely. I know that we have kids come here and kids go other places, and so we have these contracts that go back and forth. I think I just really truly want to understand how many kids we have here. I know we have staff kids, which are, of course, we welcome them and hope they will come with their parents when their parents work here. I don't know how many other contract students we had at the end, when we shut down in March. Do we? I'm sorry, I'm asking you now. Do you have any sense of how many kids come in here as tuition kids that aren't staff?
I would have to go back and pull those numbers. It is somewhat fluid. Sometimes we have families that live here, move out, but want to continue to stay, so we do have some food throughout the year. But I can pull those numbers for you tomorrow.
Okay.
Provide those.
Well, let me just say what my concern is about this. And I've actually heard this. I've kind of thought of it, and then I've heard it from a couple of sources. With districts surrounding us shutting down, I do not want to get into this situation where kids from Fayette County are coming here for $1,000 a year, which is less than our local share to our kids, our local share to our seat, because they're not having in-person school and we are. I really think that I would like to have a moratorium on any more tuition students until this COVID is over, because social distancing is part of our plan. We have kids staying home virtually, sometimes because they don't think we can social distance. And I just want to avoid any possibility of that. I've already heard a couple people tell me that they have friends that are considering that, whether they would come here or Anderson, or, we're kind of on the way between Lexington and Frankfort. So that is why I pulled this from the agenda item. I don't know if this particular contract is for somebody new or it's just the standard thing we do.
Any tuition student has to work through Garrett's office. So this is not for us to approve new tuition students.
Okay,
This is a standard that allows the students who are already,
right. But by doing this standard contract, then like if somebody from, we have one with Fayette, I assume. So if somebody from Fayette tomorrow says, gosh, I really want my kids in school, I've got to work, I'm going to put them in Woodford County schools because they're open. That is just something, I don't know how the board members feel about it. I totally want to avoid. I do not want those, the social distancing that we can achieve, or ever keep a local kid from coming back because all of a sudden the social distancing is less than possible because, we've accepted more tuition students for that reason. So I don't know the best process for this, and maybe Grant can help. And it's not on the agenda for tonight, but what do you think about this, Scott?
I mean, we can just say we're not going to accept any more tuition students from this point forward.
Okay.
I mean, everybody that's in is in
Right.
at this point. So
and if
we
they
don't
come,
need to
if
take
they
any
came here
more
last year, I don't want them to have to move.
no, and I mean we may have taken a few in over the summer, but it's always based on space and it's always based on meeting the specific criteria. And so, but if we don't want to accept any more tuition students from this point forward, we typically, this is about our cutoff point anyway, in terms of when we take any more new kids that may come from another county. But I mean, that's not a big issue, and it doesn't impact these contracts at all.
So we can just assume that from now on, we're not accepting any more tuition students.
We
and
can
because
say
I
for
think
this year.
For this year, everything is for this year, right?
If you want to say through, Christmas, we wouldn't. It would be rare that we would take any mid-year. But
I would say through the full year until we talk about it again. And because when we talk about space now, it's kind of different. Like we might have 20 kids in a third grade class, but 4 or 5 of them are virtual. Well, so it seems like we have space in that class, but when they come back, then they will be more crowded. I just think it behooves us right now to kind of, and like we talked about before, and I know there's a great, coordination between all the health department, but that's just, more people coming in that are spread out.
That's not a problem.
Okay. So is that enough to just say that we're going to have, from here on out, we're not taking any more tuition students?
That would be easy to implement. Would the board be okay with, we will have this scenario where someone lives here, has gone to school here, and in September, they've got to move. And what we do in that situation, they move out of district, but we will transition into a tuition student so they can continue going here. So I guess that's my question.
Yeah.
If we have someone that's been here and moves during this time, we're talking about putting a moratorium on tuition students, would the board be okay with?
Yeah, I think is that a big amount? Because we're also going to have kids moving in, and that's going to offset that. I just really want especially because our tuition is lower than the per share of kid that our local tax dollars pay for, that we really have to be protective of the safety and because we're in a place where the fewer people in a classroom, the safer. And I don't necessarily have a problem with that. Maybe we can just kind of review how this is stacking up month to month. I don't want to disrupt any child who's already settled in a school, but I also don't want to be the situation I described in the first place, that we're kind of, in a way, endangering our kids because other schools have chosen to shut down so that we're a convenient stop along the way. I mean, that's not a real commitment to come here. It's just a convenience.
I guess I'll weigh in on that. I'm not at all comfortable with what Gary just described. I would not want to say that you can't do it under that setting.
Right.
That just defies common sense.
It's not a large number, but obviously we have families.
Sure. And again, I don't want to disrupt anybody. I just want to stop I don't want to, and I know I'm assigning bad motives to some people, but I just do not want to be that to happen. And I've already heard of that thought, and you can understand it. I mean, parents are desperate out there. So, All right, so if we can just say we're gonna have a moratorium, then I'm fine with that. Does anybody else have anything on this?
No, but I would move we approve item H, the non-resident contract that we were provided.
I second.
Okay, motion by Mr. Wilson, and second by Ms. Bradley. All in favor say aye.
Aye.
All opposed? Okay, that motion passes 4-0. All right, now we're into our regular agenda. Mr. Hawkins, accept notification of personnel. I just found food.
So moved.
Second.
Motion by Mr. Wilson, second by Ms. Springate. All in favor say aye.
Aye.
All opposed? Motion passes 4-0. Accept notification of payment of bills.
So moved.
Second.
Motion by Mr. Wilson, second by Ms. Springate. All in favor say aye.
Aye.
All opposed? Approve of minutes of June 4, June 8, or motion passes, I'm sorry, Angel. Approve minutes of June 4, June 8, June 15th, and June 24th board meetings.
So moved.
Second.
I have a motion by Mr. Wilson, a second by Ms. Springate. Any discussion? All in favor say aye.
Aye.
Motion passes 4-0. Approve authorization to solicit bids for the 2021 school year.
So moved.
Second.
I have a motion by Mr. Wilson, a second by Ms. Springate. All in favor say aye.
Aye.
All opposed? Motion passes 4-0. Approve BG5 for WCHS cooling tower replacement project.
So moved.
Second.
A motion by Mr. Wilson, a second by Ms. Springate. All in favor say aye.
Discussion.
Oh, I'm sorry. Any discussion?
Yeah, I just wanted to just briefly say that typically we would have paid for this cooling tower out of capital outlay funds. And so this is an expense of $118,000. Since we restricted the capital outlay funds, we used general fund dollars to do that. And so I just want to point out, when we use general fund dollars instead of capital outlay dollars, that has an impact on our general fund budget. And so just briefly, that's $118,000 that instead of capital outlay, we use general fund to cover. And, we just have to be mindful of that impact.
What did we use that as capital outlay on that?
Just 1 second on
Go
that.
ahead.
Mr. Hawkins, what's the 20% remaining in the capital outlay fund? What's the dollar amount?
Would be about $72,000.
Today.
I mean, if you're talking about this year's, we typically get around 360,000, so it would be about 72,000. And I don't know that we can change a funding source at this point in time.
No, I'm just curious what the balance is right now.
I think it would be about, if you're just talking about this year, it would be about 72,000. That would be the 20%.
I call for the question, Ms. Chairman.
Yes, sir.
I'm
I thought
calling.
you said you had a question.
No question.
Oh,
I just
I'm
want to
sorry.
vote on
I'm
it.
sorry.
That's all.
Okay. Any further discussion?
But that fund rolls over each year.
Correct.
And-
If it's not utilized.
Right. So I guess I can look on the agenda and see what the balance is.
Any further discussion? All in favor say aye.
Aye.
All opposed? Motion passes 4-0. Set evaluation criteria for the, set evaluation criteria and evaluation process to be used for the superintendent evaluation in the year 2021.
I move that we use the same evaluation tool as we have previously.
Okay. Is there a second?
Second.
Is there any discussion?
I did have some discussion on this one.
Okay.
So Mr. Hawkins has requested in writing that we give some feedback pertaining to how we're going to be scoring, not about specific goals, but how we are going to be scoring in general. And I just wanted to see if he has received that.
I have not submitted any. Have you, Sherry?
Well, this is not a particular goal, but just written feedback in general about what exceeds or, the different criteria that we have. Because I think my understanding was when he asked for that, he was basically saying, what would this look like? how are you going to be scoring me on these things so that I can improve my performance, was my understanding. Is that?
Why don't you let, Mr. Hawkins, why don't you say what you want for your value?
That's what I requested.
Okay.
And I requested that back in June.
Okay.
So what is the definition of exemplary?
Exceeds expectations, I believe.
Sherry, did you submit anything? I did not. Did you just submit
I think that would
anything?
be something we would have to do as a board. We would have to decide that. So, like, you know, when you look at the policy says the superintendent shall be evaluated annually in writing by the board. The summative evaluation shall be made available to the public on request. The evaluation criteria and the evaluation process to be used shall be explained and discussed with the superintendent no later than the end of the first month of reporting for employment of each fiscal year. So, for instance, if we had a teacher say to the principal, you know, I got a 3 on this last year, I'd like to get a 4. You know, what kinds of things are you looking for? What kinds of, you know, how can I, you know, get this to increase? My feeling is that's what Mr. Hawkins asked us for.
Mr. Hawkins, you're right here. Just tell us. I mean, you know, Sherry says, I feel that's what you mean. What do you mean?
That's what I asked for. I asked, what does exemplary look like?
Okay.
So what I feel like is we should provide it.
I felt like the evidence I submitted was exemplary, but obviously it was not. And so I asked for specifically what it would take to be exemplary in those standards.
So if we have to do a special session to get that together, I'm fine with that. I'm just saying I feel like we should answer that question as the people doing the evaluation. It's our job to say, this is what we're looking for, this is what that looks like, and this is how you can do those improvements. That's what all of the KSBA training I've ever been to for evaluation says. So my question is just, you know, are we going to set up a session to be able to get together and do that? That's something that's been requested that I believe we need to do. I'm not asking if it's requested, and I'm simply saying, as the people doing the evaluation, that would be on us to sit down and to come up with that request that you made.
If we're going to do that, we would have to do that in an executive session.
No, you know.
I think we should ask Grant.
Well, ask Grant. It depends on how the conversation's going to go. Hey, Grant, why don't you go ahead and explain to me what you are explaining this?
He's muted right now.
Do you want me to text him?
Hopefully he heard about it.
Hopefully you heard him unmute in a second. There he is.
Can you all hear me all right?
Yes, sir.
I'm having an awful lot of trouble hearing you all. I know the YouTube feed sounds good, but the microphone trying to pick you all up from across the room is just really, really echoey from my end. So it's my technology problem, not your technology problem.
Do you need Sherry or anybody to repeat?
No, as I understand it, well, maybe, but let me say what I think you're asking me. The conversation we've had at a couple of previous meetings is the extent to which conversation with the superintendent about the evaluation for the upcoming, the just started school year can be in closed session or open session with regard to the expectations for the performance evaluation. Is that what your conversation or what your question is about?
Yes. Yes. And
Okay.
what I said was that if it was going to be specific to Mr. Hawkins' performance on each of those standards, what an exemplary would be, how we would define it, that conversation has to happen in an executive session. If each member chooses to email back to him independently, then it does not.
Yeah, if the conversation or the expectations are, I think as the superintendent just said, if there's something about that a board member or multiple board members feel about last year's performance or the last evaluation, that there would be specific conversations to be had of last time you did X, and if you had only done Y, then I would have given you a higher rating on your evaluation. That needs to be in closed session because that's tying to a kind of a personal conversation with the superintendent, and that fits the statutory exception about preliminary discussions that are mandated to be in closed session. If it's more general as far as setting the standards, setting the goals to be completed but not tied to previous performance.
Well, and I think my preference would be just to move forward. I don't think that we can just get mired in conversations about the past. Obviously, we didn't have those conversations on the previous evaluation, but that's over. It's in the past. It's previous. So my preference would be moving forward, how we can do a better job or how we can communicate more effectively, just general kinds of expectations, standards, and goals. So my preference would be that would be something that would be general and forward focused, not we didn't do this, we didn't do that, we missed this deadline, we didn't, do this appropriately. Nothing like that. I don't want to rehash the past. I just want us to move forward and follow our policy and follow our procedures and be responsive to your questions. That's all I want.
I will say that it is not obvious that feedback was not given before. So I'm confused here. So first I'm hearing, I just want to make sure I'm clear on what the goal is here. So I thought I heard that we want to look at last year, point out what was missing, what would have made it better. To me, Grant, as you have explained this, that would be an executive session discussion if we look at it that way. If we look at it going forward, we're going to use the standard KSBA instrument. We might have these extra goals. That is an open meeting discussion. But I thought I was hearing Mr. Hawkins let me know. You were asking for examples, and the only way we can give those is by kind of going back and saying this would have been a higher if this would have happened. So that would be executive session. Let me just make sure. Is that the distinction I'm hearing here, Grant?
Yes, I think that's fair. I'm approaching this from the point of view of essentially what the superintendent just said. He felt like the evidence he presented based on the goals and standards as he understood them previously, that he felt like he presented evidence that warranted the highest rating, exemplary rating. And yet he didn't get that rating from either from all the board members or from any board members. I've not looked at all of that documentation. So I understand the question to be from him a more specific question of if what specific evidence was presented previously didn't warrant an exemplary rating, what would you have needed to see to get that? And from my point of view, that is that kind of individualized discussion with the superintendent that ought to be in closed session based on the statutory language.
Is that what you would describe as what you're wanting?
I just want to know what exemplary looks like.
Is there a reason
other than saying it exceeds the expectation, what is it that you're looking for in standard 1 that would make my performance exemplary? Even if you're not looking at last year.
Okay.
How do you define that for me going forward? What is exemplary?
And would that not happen normally at the first of the formative evaluations?
No, there should be some clear expectations set forth if we are looking to say this is what we would expect you to do in instructional leadership to be exemplary. Now I have a target to move forward. And if I don't hit that target, I don't hit that target, but at least I know what the target is.
So how specific do you mean? Like, to be exemplary, you need to, to me, exemplary is going above and beyond. Exemplary is an unusual, it might be common in some places, but in most evaluations, it's not that usual. So it's really going above and beyond. I'm going to let Danny and Sherry, how do you want to go forward with this to resolve?
Well, I definitely do not believe it's something we would do tonight.
Have you done any work in defining what exemplary is?
Yes, I've actually looked through the instrument, and I believe the board as a whole needs to sit down with Mr. Hopkins and go through that and say, so we would anticipate you would have 5 of these 7 markers, or we would anticipate you would have 6 of these 7 markers, or we would anticipate you would have 5 pieces of evidence showing this, or we would anticipate whatever the specific standard and marker is, so that then he knows if he's reached it and we know. It's not just kind of a, how we're feeling that day kind of evaluation, because that is what you're not supposed to have. It is supposed to be professional. It is supposed to be guided by the instrument. And so I don't think there's any problem with all of us sitting down and doing that. I don't think it should be done in the middle of this meeting tonight, obviously. But I just think that's something that would be useful moving forward for everyone.
So that, Grant, that definition sounds like an open meeting discussion. Correct?
I agree with that.
Okay. What would you, Danny, did you have a different view of how this would happen?
Yeah, I think that's, I have a couple of thoughts. One is our adherence to the tool and our policy. The tool clearly defines when comments are required and when they're not. So that is one thing. I don't have an issue having that discussion at all, but I don't know how you say, this is something I would like to have seen you do differently without discussing things that happened. I also don't understand why it would be an issue to do this in executive session. Is that something that you...
Well, Grant has just said it needs to be an open session. I just think that we don't want to be a dead horse. I just think that's something we need to schedule.
If we're going to talk about the past performance,
which
as an indicator of what we would like to see improved for the future, it has to be done in executive session.
Which I don't think that's what I'm speaking of. What I'm speaking of is how we can move forward. Let's don't argue about the past performance, the past evaluation, the past numbers. Let's move forward and make sure we're following our policies and our procedures and our KSBA training on the new evaluation year. That's all. And I don't want to.
And I think that this is so interesting to me just because throughout our re-entry and so many of our other discussions, it's like it's case by case. We don't have a protocol. We're not going to nail it down. We're not going to get pinned down. But, and I think some of this will be like that too. We do present evidence. We do present concerns. So it's that's just an aside of when we want case by case and when we don't. But
any of that should be in closed session is what Grant has just said. What I've heard him say is anything that's individualized or performance-based should be closed session. So those are two separate things.
Yeah, and that's all I'm really worried about right now is whether we should be in closed or open session.
If I can jump in with one more comment as the voice from above.
Yes.
Yes.
I don't want you all to feel like you're locked in to choosing an either or. Most of the conversation might be a public conversation, and if an individual board member or a few board members want to make a motion to go into closed session for a limited portion of that to specifically discuss a few concerns that relate to previous performance, that limited conversation can be in closed session. This is not an all or nothing choice that you're making.
And we will have you to tell us when to do which. Okay, do we need I guess we do need a special session on this if we're reaching the end of July. I don't know if there's other things we're going to have special sessions on. Next Monday is past July, right? Yes. Mr. Hawkins, would you, if we can't get a meeting together in a week, would you be amenable to doing this next Monday, even though that's past the first month of your contract?
That's fine.
Okay. I mean, is there any time we could meet this week to do this? I'm fine.
If we may need to get back together in the next week to 10 days if you're going to look at case numbers and things like that.
And governor.
Yeah,
Okay.
I think we've got to be mindful about how many times we're meeting.
I agree, and I definitely think with our next meeting not being scheduled till August 20th,
I believe it's the 17th.
August 17th, still 9 days before school starts, I totally expect. I think we would prepare that things are going to happen. That's only 9 days before. So, if you're amenable to us going past July 1st, we'll see what other kinds of meetings we need. Is that okay?
That's fine.
Okay.
And Debbie, if you want, I think Grant has said if we can schedule an open meeting, we probably ought to. So if you want to go on and schedule that now and say that we will get updates about reopening and also this, that might make sense. So the public has notice. They know
Right.
Yes.
Yeah, and they need notice, but I don't know too, with the fluctuating information, like we might have a meeting and then we might not have the new government information.
I think if we, Madam Chair, because I've tried to be quiet all night.
Okay.
I think that it would behoove us all to schedule a special meeting for next Monday,
Okay.
6 o'clock at the high school. And part of the agenda should be to, Superintendent wants his evaluation, we'll do that. But I do think that we ought to, in that special meeting, have the evaluation at the end of the meeting so that we can devote the meeting to COVID-19 related issues.
Okay. Everybody is, so that's August 2nd?
Can I just make one suggestion?
Yes, sir.
On that is that we look at potentially next Wednesday or Thursday. And the only reason I say that is that would give a little more than a week for the governor's mandates that are taking place tomorrow to see if there's any impact.
So why would we wait on the governor's mandates?
Because I think that will help us determine our cases going down at that point in time due to the new restrictions that are, because those restrictions go into place tomorrow. And I think that would at least give you a week and maybe another day or two to see if it's having a positive impact. And so that would be.
Yeah, but I would say, Madam Chairperson, next Monday, it's a normal meeting night. I think we're going to have all the information. You're never going to have all the information. You've stated that several times tonight. It's always changing. But I think next Monday would give us enough time to be able to have
Well, or August 10th may work well too, because that gives us time to get any updates and make any adjustments based on, the numbers. So I don't think we'd be in a position next Monday necessarily to have that information based on the new restrictions.
I would advocate for the
Monday.
3rd.
Yeah.
Okay, I'm going to say the 3rd too, because I can't come on the 10th. And I don't know what Allison's schedule is, that as we get into that week of the 10th and later into next week, we're going to be gone. So I would rather do August 3rd.
I just hate for us to meet on the 3rd and then have to meet again the following week because there's new guidance and there are new things coming out. I just think limiting the number of meetings makes sense, and waiting until you have all the information makes sense too. So, I'm sad that we would rather just do it on the 3rd instead of.
Well, we can always move our planning meeting too to the 10th. We have more, because if there's a lot that comes out by the 10th, we can always move that planning meeting forward.
True, but it just seems to make sense to kind of do one meeting, if you're doing one special meeting, to do it, in a manner that makes the most sense.
Pros and cons, yeah. So August 3rd, 6 o'clock, we'll have and then that'll be closer to the deadline for Mr. Hawkins' evaluation. And the other thing on the agenda will be re-entry updates. Okay. What's next?
I'll rescind my motion. Or actually, no, never mind.
There's a motion on the floor by Ms. Bradley, a second by Mr. Wilson, to use the evaluation process next year that we use this year. Now, if you don't want to move, I just didn't want you to move on with that.
Right, we don't want to leave that hanging. Thank you for reminding me of that. So we will just table this.
She made a motion on the instrument. I think you can approve the instrument. It's the process.
Okay.
I think it would be,
Okay.
yeah.
There's no change in the instrument as to what the definition of exemplary is. If there is, we can change it then. All right, so let's vote that we're going to use that instrument. All in favor, say aye.
Aye.
All opposed? Motion passes 4-0. Statement of racial equality. I know that I believe all of us received an email from a staff member that asked us how we were going to respond to this publicly. And that was a very good email and a very good prompt. Something that I'm afraid has been put on the back burner because of COVID, understandably, but we really cannot put it on the back burner. I don't know how to start this discussion. Mr. Chenoweth, my understanding was that if we're going to have some kind of joint statement, we need to discuss it in public. Can't really send those email drafts around and edit. So that's what we're doing here tonight. Mr. Wilson had asked that we move it from last week. I asked Mr. Hawkins to put his statement that he read, I believe, at the Juneteenth, that you gave. Okay. Well, he had devised a statement. I thought it was a good starting point. So at least it's something in writing. So I don't know if this is something we want to issue as a board, if this is something we want to maybe shorten to more of a statement, or what our feelings are on it. So, but I thought it was a good starting point because it is the one thing that we have in writing.
I did have a quick question. We got this. It was on June the 12th, so it's been quite some time ago. We got the proposed draft. I just wanted to know, I did have a quick question about how the statement was developed, and if you could, I know it's been a while because June the 12th was when you sent it out to us the first time, but is this something, can you just explain that again?
Sure. Actually had some conversations with a couple of employees and also with our district staff. We reviewed some documents and some statements from other districts and other companies, for that matter, that had released statements, and we put together this statement as a district staff, and then we sent it to about 6 employees to ask for their feedback on the statement. We got their feedback, made some adjustments based on that feedback, sent it back to them for their review. They felt good about it, and then I sent it on to the board at that point.
Good. So it's a collaborative effort. I think it's a good. I like it. It's a strong statement. It's difficult, and I wouldn't mind doing this. I really wouldn't, but I would hope that we would also, as a district and as a board, maybe like highlight 3 things we're dedicated to, like 3 actual steps, whether it's hiring, whether it's meetings, whether it's just like 3 things in here, because there's a lot of do the right thing, but maybe just like say what the 3 things this year for us the right thing means. What is the right thing to do? To just kind of go a step behind this and just like make a measurable steps that we're going to take. We're in a very weird world. We're consumed with COVID, but maybe in a way this is even more important because of that. So that would be my only suggestion, to maybe just try, not necessarily tonight, but to come up with 3 things that our district is actively going to emphasize. And I know we have the equity audit. They've talked about the visuals in the schools. That seems like a good thing. It's a great thing, but it's not. But it's achievable, and maybe we could go one step beyond that. I don't know what she even presented to us is.
Well, there are several things highlighted in there that we are going to continue to focus on and work on.
So maybe we could just like.
And that was the thing too, is that we see things through a different lens.
Right.
And so that's why I reached out to some of our employees who see it through a different lens, and to get their feedback and on the statement itself. So, but whatever changes the board would like to make, certainly happy to make those. And
I sent my thoughts on any changes back to Mr. Hawkins, just things that I would add. I viewed it just as additions, not in place of anything that you had prepared.
Well, when I received it on June the 12th, I responded back. I thought it was timely. I thought it was needed. I thought it was a good statement for, Woodford County schools for us to make. I think that, we're doing the equity audit, and I went to that training and had a real great appreciation for that, for the leader, and then for our staff and for our folks that were there too. But I do feel like that this came to us on June the 12th.
Well, we understand that.
And for us to kind of just put it off for months and months and months is not acceptable. I think we have to really walk the walk, not just talk the talk. We can't just say we care about things and then, as a board, linger on this for months and months. And so my hope is that we can just approve this.
I'll remind you, Ms. Springate, I've read.
I'm sorry?
I remind you, you said we haven't done anything on this. I read the statement that the Bullitt County Superintendent, which I thought was wonderful. I made comments at that night that we have to make improvements in hiring. We have to make improvements in achievement gap closure. I said all that. I referred to the thing. Ms. Edlin commented. Ms. Richardson commented. So you can't say we've ignored it.
Ambrose, with all due respect, you just said you read a statement from a superintendent from another county when we had a statement from the superintendent and the staff of our county, and we ignored that. And now, months later, we still are arguing about if we want to give this statement out as a board. That is my point. You are making my point for me.
No, you didn't. You saw that I read the statement, but I gave my own personal views. I said we have done a horrible job in minority hiring. We had to do better. We haven't done a good job in achievement gap. So, I just don't take your criticism.
Our superintendent and our staff gave us a letter 3 days before you read the statement from a Bullitt County person. That is my point exactly, Ambrose. As a superintendent team with the board, we should be saying, thank you and your staff for doing this. We should be emailing saying, please, yes, let's discuss this and release this. It is now months and months later. That's not acceptable. That's all I'm saying. And that is my point. My point is, we've had an equity team working here in Woodford County for, a year or more.
Sherry, why didn't you read that night? I mean, you put everything
This
on
is
us.
a board decision, Debbie. So what I'm saying right now is, can the board please approve this statement?
Okay.
All of us as a board, because I can't read this statement on my own as an individual. When we have issues in the county, I do try to speak up. If there are problems with, equity or with, things that shouldn't happen, I do try to speak up. And I think I get attacked for that sometimes. So instead of trying to speak up as an individual, because I know this is a board statement, all I'm saying, Debbie, is can we please say, let's approve this statement and please have a statement out there showing that we do acknowledge what's going on in the world as far as equity.
Hold on, just
This
one second.
evening, I have the floor. Ms.
I don't want to cheapen the issue of racial equality in Woodford County by making it into a school board squabble.
Absolutely.
It's not a squabble. We need to
Now,
approve
Ms.
it.
Bradley speaking.
We need to approve the statement. Mr. Hawkins, you can add my changes or not, but this issue deserves more than the pettiness it's receiving right now.
And I am not trying to be
employees.
petty. All I'm
I
saying is,
understand.
can we please approve it? And that's all I'm asking.
I let you speak.
The,
I'm just saying,
Let Ms. Bradley
our
finish,
employees, our students deserve more from this board than they are receiving right now.
Well, I
understand that may
apologize.
not be your intention.
I apologize if I seem testy. However, we've had this since June the 12th, and all I'm asking is that we please approve it. That we say to people, we're not just saying that the Bullitt County Superintendent's message was important. We're saying we have a message. We had a message on June the 12th that this board has failed to agree upon or to allow the superintendent to release. And that's all I'm saying. We need to release it. If we all believe this, Danny, then why are we arguing? There needs to be no pettiness.
Nobody's arguing.
We just need to approve the statement and release it. So that's all I'm making a motion.
but the,
Mr. Wilson, please continue.
thank you very much.
Can I clear up one
What?
just time thing? Mr. Wilson told me the week before we got this statement. And again, I hate to get into the pettiness of who wrote what first. Like Miss Bradley does, it overshadows. But I'm going to say it because sometimes we just sit, four of us, and take it. But so I'm going to clear the facts up on this. Mr. Wilson was very concerned about this and came to me and wanted to read this statement. and said he was going to do it during discussion at our planning meeting. Our meeting that night went 3.5 hours long. By the time we got to discussion, all of us were very thankful that he said, I'll do it next week. So I put it at the top of the agenda for next week because I know he wanted to do it at the planning. That was on a Monday. On Thursday, we received Mr. Hawkins' statement. So it's not like we had it when he planned to do it. He planned to do it anyway. Here's my point, and I think it's Danny's too. If feelings are hurt, I'm sorry. If offense is taken, I'm sorry. But we are 4 adult white people up here, and we know nothing about offense. And that's why Mr. Wilson read it that night, because we had not made a comment. That's why I commented on it. And it's all boiled down to who gets their statement read first, not that something was said. It's who was offended, who should have got to go first on this very important thing. Let's read all these statements, guys. This is the exact problem that I can't believe this. So we can issue this statement. That's fine. Mr. Wilson, I'm proud of you for doing that week, for wanting to do it even a week before. He asked me to start a meeting with 8 minutes and 45 seconds of silence. He decided against that and just read the statement instead. This is near and dear to his heart. And I am highly offended that anybody thinks his actions were some kind of personal attack against Mr. Hawkins. Let's stop.
Nobody said that, Debbie.
Let's stop.
Can we please just approve the statement? Let's just be adults. Let's talk about the racial statement, the statement that
No,
is made
you did say that, Sherry.
the Board of Education statement. Can we please approve this and move on?
Let me speak.
I've heard you speak. Can we please approve this and move on?
You have absolutely taken this as who got to read their statement first. That is the priority. The priority is our kids in this county, that somebody said that something as soon as possible, and that's how that is. So let's not pick at each other. Let's think about our
approve
students.
the statement and move on.
Ms. Springate,
No, Sherry, you send in these slides.
You need to review this. Go back and watch this meeting, Debbie.
I will.
Please go back and watch this,
I
because
will.
I have not attacked anyone. All I've said is, can we please approve this statement? We had a statement made by Woodford County folks about this issue, and I just want to approve it. I don't want to argue about who did what first. I don't want to argue about if it's right or wrong. Watch the video. Go back and watch the video, please.
Do you think it is wrong?
I just want us to approve this statement. I think it's an important thing. Mr. Wilson thinks it's important. Clearly, everybody up here thinks it's important. There's nothing to argue about. I just want us to approve this statement so that we can have a statement out there. It's past due. I want us to have one. I want us to show that we care, that this is important to us. That's all I want. That's all. I'm just making a motion that we
Does
approve
anybody
this
have any
statement.
changes to this?
Ms.
Mr.
Eva,
Wilson? Yes.
Thank you. Yesterday we watched John Lewis being taken over the Edmund Pettus Bridge again. That he went over March 7th of 1965. And I listened to a documentary about him, and he was talking about, he said, everybody thought I was worried about the police who hated me, about the dogs that were going to bite me and tear my skin from my body. The viciousness that I would be beat, that's what I was worried about. But he said, the main thing I was worried about was them throwing me off the bridge into the water because I couldn't swim. But arm in arm with other people dedicated to change, they walked on that bridge and they took their beating. Racial equality is important to me, extremely important to me. John Lewis said, when you see something that's not right, when you see something that's not fair, when you see something that's not just, you have to speak up. He says you have to say something. You have to do something. And by doing that, you can make a difference. The statement, I think, is a fine statement. If we look at this, this was all brought about a singular event, the 8-minute and 46-second execution of a man, George Floyd, in Minneapolis, Minnesota. That's what started this. And from that, we've had protest, and a new light has been put on this. And sometimes we think when we're board members that maybe there's not that much we can do, but this is a position which we can address racial inequality. We can say, absolutely it exists. And to your point, oftentimes we don't understand how it feels. I think we all want to understand. We all want to have a feeling, but we can't. The term Black Lives Matter means something to me. I'm not afraid to say it. Black Lives Matter. And I would like to incorporate those 3 words in this statement.
Okay. I would agree with Mr. Wilson. And I am going to say that I did get heated, and it is because we all need to speak. It doesn't matter who speaks first. It doesn't matter who says what. It doesn't matter, but we cannot make it matter. We cannot. I know Mr. Wilson's heart. I know that of all of us, at least the ones I know up here, his heart is in this. And he read it that night, and he talked to me before about what he wanted to do and how he felt. And for that to be minimized, to try, oh, well, he should have read our statement, not any statement. Let's all read any statement we want. We cannot read enough statements. We cannot talk enough about this. Let's not get into a competition of who said the most, who said it the best, who said it the first. And that's why I took offense at it, because that is what it, like, why didn't we read this? And Mr. Wilson read that. That was where my heart was speaking from. That's where I was coming from when I became heated. I agree with Mr. Hawk. I agree with Mr. Wilson that we add all Black Lives Matter. Does anybody want any other changes to the state? Mr. Wilson, did you have a point in the paper where you wanted that or the
no,
statement?
I think, well, first, Superintendent Hawkins, do you mind us adding that to your statement?
I don't have an issue with that. I'm not sure where it would be appropriate, but how about if I work with a couple of employees? Please
Okay,
find out
and
where
send
it
it,
may be.
Mr. I'm fine with that, Mr.
Yeah,
Wilson's
I trust
judgment.
you.
If others want to see it, that's fine.
That's fine.
I know we need to be careful about emailing everybody.
No,
Are there
that's fine.
any other changes?
Yes, I would just say, Debbie, before we conclude, that I apologize if you took offense, Ambrose, that I thought you shouldn't speak. I believe we should all speak. My only point is, please, as a board, let's speak. Please, as a board, let's approve this matter. And please, as a board, let's speak for Woodford County Board, School Board, with our superintendent on this, because it is that important. Not minimizing anyone else's words. I'm simply saying, as a board, we need to do that. And that's why I would make a motion that we approve the statement.
To have, as amended by Mr. Wilson, with adding Black Lives Matter and appropriate in a place that you'll work with Mr. Hawkins to put it.
Yes, just call me Mr. Hawkins, we'll work that out.
Okay.
What about Miss Bradley's additions?
I thought it was a replacement of some things, so I mean, I don't know how well.
Well, you three can work on it together. That's
Yes.
only 2 people.
Let's
So.
get it out
It
tomorrow.
appeared to be a replacement of.
And then we'll,
So,
So let's go ahead and vote on it with those amendments, even though we don't have the exact document in front of us. I'm assuming that's fine, Grant? He said yes. Okay.
So
Is
I
he
make
there?
a motion that we approve this statement
With the amendments discussed.
with the amendments.
Second.
Second by Ms. Bradley. All in favor, say aye.
Aye.
All opposed?
Madam Chair, can we have a 5-minute break?
Yes, please.
Is there any water in the building, Scott? No?
I don't know. All right, car, get one.
help with packing all this up?
Can we do it tomorrow? Hey, can we do it tomorrow? Thank you, Ryan.
It's too heavy to pick up by itself.
Okay.
Put it on those cards.
Yeah.
We can go pack it up.
Yeah, you're right.
Does anyone have your item H? Do we have any other business?
I don't think so, unless we need it. No, executive session.
Oh, okay.
Talk about ordinance.
I think they posted it. No, I thought you were asking if
Madam Chairperson,
I think it's posted.
Bring the order, meeting back to order. Is everybody ready?
It just started off on the first.
Item H, public comments at future board meeting. You ready, first Bob? Did that mean wait or yes?
Yes.
Okay. Public comment at future board meetings, item H.
This was just an item I had asked to be added because I just felt like we need to have public comment on all of our agendas. I think it's necessary for transparency. Over the past, several weeks, we've had special meetings and items placed on the agenda that the public has had no notice of. I just think it's important that we allow public to have comment at any of our meetings. I think that that's just part of what good governance looks like. And so I would make a motion that we add public comments on all of our agendas for future board meetings.
I'll second that to get to discussion. In looking at this after Ms. Springate brought it to us, I reached out to the counties that surround us to see how they handle this, and heard back from Scott County, Harrison County, Jessamine County, Anderson County, Franklin, and Fayette that they have public comment only at their regularly scheduled meetings, or at their regular meeting, not at their planning or specials or work sessions. So I want to note that, obviously it has not been adopted as a best practice in the central Kentucky area.
I guess my comment would just be, if we only did it at regular meetings, then that means the public would not have been able to ask any questions about the COVID or about the pandemic or about school reentry. They wouldn't be able to ask any questions about, like if anyone wanted to comment on the equity statement tonight, they wouldn't have been able to do those things if they're on, any agenda other than the one monthly meeting that's the regular agenda. I just don't see why we would not have public comment. What would be the rationale that we don't want the public to be able to comment when we have a meeting?
I think it's not necessarily about precluding that. And one thing that I heard from the superintendents and from the different board members was that because we are all in touch with our constituents, those same questions are still raised at meetings through us. And that, if you look at the 119 questions that were submitted for the town hall, those were communications between the public and the board. I'm just saying they don't do it this way. I'm just putting it out there as information. And, this has not been the policy in any of your board terms, including Mr. Wilson's, which is of great length.
Yeah, I do believe that times are a little bit different right now. We have virtual meetings. A lot of counties aren't having public comment at all during their virtual meetings. I simply feel like that, we are here at a meeting that is an open meeting that is funded by our taxpayers. And should they wish to send a comment in while we're having this open meeting that they're paying for, I just felt like it would be a good idea for us to allow that. I know it's not mandatory. I know it's not required. I just simply think as a best practice, there would be no reason not to allow the public to be able to comment about items that are specifically on the agendas. We're having these special call meetings, quite often, and those are important issues that the public needs to know about. They may not even know we're having a meeting, when we schedule them and there's no newspaper notice. If we decide, like for instance, if we scheduled the meeting for the 3rd and we waited and did that by email and scheduled it on Thursday or Friday, the public might not have known we were going to do that. So I just think it's important that we are as transparent as we can possibly be and that we are, as receptive and responsive to the public as possible. So that really is the only reason that I asked for it to be on. We add it routinely at different times. The chair added it a couple meetings ago. So I just think just as a policy, having it as an option that's on our agendas just makes sense, like having discussion. Some counties don't have discussion on their agendas. I just, in the interest of being transparent and receptive to the public, that was the reason I asked for that to be added.
I'm going to ask a couple of follow-up questions. Have we had any agenda item that was not noticed? Ms. Springate said that people don't even see the agenda items. Have we? I think we've been very, very thorough in providing all agenda items on the notice. I don't even remember changing, we do have the ability if something comes up to add an agenda item the night of the meeting. I don't even remember us doing that.
That wasn't my concern. What I said was we've had meetings where the public can't comment. So for instance, we had the meeting about restricting the funds. The public had no opportunity to comment at that meeting. We restricted that $350,000 at a meeting that was not a regular meeting. The public had no ability to be able to have a public comment at that meeting. So that is what I was referring to, not what you're saying. I don't know.
Okay.
That's a different.
And then also, as far as public comment tonight on the racial equality, this was on our agenda last week. We did table it to this week. So I think anybody who wanted to respond or comment on that would have had ample opportunity, just like, Ms. McCowan's on the reentry issues.
Right, they could tonight, but they couldn't last week, and that's my point exactly. I feel like the public
Actually,
should be able to comment.
The budget restriction of the 350,000
Yeah, that was at a regular
meeting on November 18th.
Yes.
No, we approved that.
In June 24th, when you just redid it.
Oh, and we redid it.
Oh, well, that was changing the verbiage.
Right, but just regardless, just as a practice, when we have meetings that the public can't comment, and we have agendas that the public can't comment at any meeting except a regular meeting, that's just my concern. So I would like for the public, just like at a regular meeting, to be able to look at the agenda, and if they have something they'd like to send a comment on, to be able to do that. That's all I'm asking.
Okay, so your motion is that we have public comment at every meeting.
That it be added to the agenda so that it's allowable. We may not have public comment in every meeting, just when the public chooses to comment if there's something they'd like to comment on. So I'm just saying we should give them the opportunity. So yes, my motion would be that we add public comment to the board meeting agendas.
Is there a second?
It's already been moved and seconded.
Oh, I'm so sorry.
It's okay.
Then. Any further discussion?
Mr. Wilson?
Okay, all in favor, say aye.
Aye.
All opposed? Motion passes 4-0.
Thank you.
Or did you vote, Danny?
I'll vote aye.
Okay, 4-0. With the same, I will say they will have the same restrictions that it has to concern things on the agenda.
That's our protocol, yes.
Madam Chairperson, I know the meeting is late, but to follow what Ms. Springate said about openness and transparency and everybody knowing the facts, the superintendent made reference to a poll that he received, we all received from the teachers. That's what you were talking about.
Mm-hmm.
And then Mr. Graves in the public comment, Ms. Springate commented on it. Could we have just a little feedback so that the public will understand what that survey said about the thinking of our teachers?
Yeah, it just, and obviously I don't know how the survey was conducted about the validity or anything along those lines. It did express some concerns.
What do you mean validity?
Like, I don't know who developed the questions.
Oh.
I don't know how they were developed. I don't know if there were any safeguards on people not being able to fill it out multiple times. I don't know that. I know it was forwarded to me, so I could have taken it. So but again, the feedback we are utilizing in our planning. They had some concerns about PPE, and we are going to ensure that we meet that.
But I don't need. Yeah, I understand that.
They have concern about enforcing the mask, and we want to certainly make that a part of our procedures and our expectations that we have every day in our classrooms.
But they also, I thought it was important information about
it. Is.
The last time we talked before we voted on the reentry plan, we talked about, and it had a lot to do with my decision to vote yes, that 90% of our teachers wanted to return to work. And if you remember, we talked about that openly. Mr. Wells entered in, you talked about it. We tried to get 89 or 90. What are those other 10%? But share with us what the results of that poll say, because it's completely different.
Well, again, they only gave them two choices. They either said virtual or in person. We gave them three. We said, would you prefer to do virtual? Would you prefer to be in person? Or are you good doing either one?
But what was their
And that was over 80% that was good doing either one, or 85% that was good with doing either one.
I think Mr. Wilson's asking what their results were.
I don't have the percentages exactly in front of me.
From,
I know that
from
a bigger
WCEA.
chunk,
It's 61.86% said they would prefer virtual academy, and 38.14% said they would prefer traditional in-person teaching.
right? And we had about 42%, I think, that said that they would prefer in-person. 42 or 3%, I believe, said that they would be comfortable doing in-person or virtual, and about 15% said that they would prefer to do virtual.
The one
So again, I think what you have to look at is that the purpose of the two surveys was very different. Our survey was to determine, are you able to return if we can go back in person? And when we say, are you able to return, are you in one of those high-risk categories that would preclude you from being able to come back to work? And so that is a driving force behind what we, to help us be able to staff appropriately. How many of them would need to be a virtual teacher? How many would feel comfortable doing either one? That helps us in terms of how we staff based on the responses that we get back from our parents. Theirs was much more about, do you have some specific concerns about the reentry? And we're going to use that information. That's going to be very valuable for us. We actually, again, discussed it very thoroughly today.
Good. I'm glad to hear
we want
that.
to make sure that our reentry plan tries to address those concerns as best that we can. I think it's also important that our staff understand that we want them to go to their building principal. If they have a concern about something, then let's bring that up, because that's who can really address it when we're talking about the reentry plan itself. And so we are going to look at that information. We're going to, again, try to look at those concerns, make sure that our reentry plans address those. One of their biggest concerns was that families wouldn't support healthy initiatives.
Yeah.
And again, that's part of why we talked about creating that form to send home that parents would sign off on.
Well, good. I'm glad.
So we are certainly going to look at that information. And again, I'll go back to the PPE. We've already made multiple orders to ensure that we have what our folks are going to need to keep them as safe as possible in the classroom.
I think,
Comment on
this.
One more thing, and then I'm done. Something that concerned me, there was a pie chart about if you had to come back. You have the pie chart about retirement. Could you read that?
I've got it right here.
If eligible in 2020, 2021, would you retire due to concerns over COVID-19 and its impact on the teaching environment and/or your personal or family health? And the response was 81%, or 81 people said yes, and that was 43.55% of the respondents, and 105 people said no, which was 56.
So, but if 81 people retired, that would be horrible. That's their privilege, but reopening it would throw up.
Well, and I think what I was going to mention is
That's all I have. Thank you.
that the survey that we sent out to our employees defined the criteria for reasons to not come back, and said, will you come back if we offer in-person education? So those folks have all signed contracts. They had 4 reasons, I think, that they couldn't come back. But that didn't assess their comfort or their feeling of safety or their willingness. It just was, will you meet your contractual obligation or not?
Yep.
And I think they feel, the teachers that have reached out to me feel that in some ways this survey allowed them more of a voice in saying, where is your comfort level on returning? Do you want to return in virtual instruction or in-person instruction? And that amount is a big difference.
Right, and again, our second survey was completely anonymous.
I appreciate
And,
that,
and it,
but it did not ask
told-
that question.
No, it said, would you prefer virtual, in person, or both? Or are you comfortable doing either one? It actually gave them 3 choices. And it was anonymous. Only about 15% said virtual. It didn't have a qualifier. It said, what was your preference?
I'll have to go back and look at it. And the other thing that is concerning on their survey was the question, and Angela, are we able to attach this to the agenda so that people can
It's
see?
not an agenda item.
It can be attached as a,
We could
I'm
put
just
it on
saying
the
that it's not
website.
an agenda item.
okay.
We could put it on the website.
But if Ms. Bradley put it on the website, you could do that.
Yeah, and we,
Yeah, okay.
we'll put both, we'll put all the surveys up.
The question of leaving
Mhm.
Woodford County. And if not eligible for retirement, would you consider leaving Woodford County schools due to concerns over COVID-19 and its impact on teaching environment and or personal and family health? And it was 60 people said yes. And 134 said no. Again, to Mr. Wilson's point, if we were to lose 60
Right.
teachers, that is going to be devastating to our district. And I know you know that, but I do think.
Absolutely would. And, you know, and again, I go back to 65% of our families have indicated they want their kids back in school. And if we lose 65% of our families, what happens then? And I struggle with that. That's the balance that we have to walk. And that's the fine line, is trying to meet the needs of our families and to try to ease the anxiety of our staff. And I know there's anxiety. I mean, we're all dealing with something we've never dealt with before. People are probably anxious about going to Kroger when they've never been anxious about going to Kroger before. How can we ensure that we are doing everything possible to make it the safest environment possible and to reduce the risk as much as we possibly can? And I think you heard from Cassie tonight that our district is doing a fantastic job of trying to minimize the risk as much as we possibly can, knowing that there will be risk. And, you know, to your point about if you're eligible to retire, if you had asked that question two years ago when we were going through the thing on pensions, probably 95% would have said they would have retired. And so depending on the circumstance, that will drive a lot of responses in questions like that.
No, and I understand that. And certainly I don't mean to diminish the efforts that you all have taken in preparing for it to be as safe as possible. But on the flip side, I don't want to diminish the concerns of our staff.
And I don't, and I don't think we are. I think we are doing everything we can as we develop that reentry plan to ensure the safest environment possible.
How are your peers handling the thought of losing 65%? Like, what do they do?
I mean, when I say lose 65%, I don't know how many of those people may look to go someplace else. I don't know how many of them are going to be in a situation where they have to choose a job or a child. I don't know that. I know that many families, I had many parents reach out to me during the whole survey piece to say, we have no option. We cannot do it if our kids aren't back in school. And that weighs heavy on me. And it weighs heavy on our staff. And I mean, every meeting that we've had, and we meet multiple times per week to talk about the reentry, you have no idea. You have no idea what we are trying to deal with to make this the best situation possible. And I'm not saying that because I want sympathy. I'm just saying, unless you sat through those meetings and you tried to answer, we probably answered 300 questions in public comment, town halls, board members. We've done another hour and a half with our health department. And I think we've been able to answer almost every question. And so I think it speaks to the level of preparation that we've tried to put in. And I could not be more proud of a group of people than those folks sitting right over there for the work that they've done and what our principals are doing to try to ensure a safe return.
And I think we all echo that for sure.
I think we've all not put in the hours and days, but have thought about it daily. Because in the end, it's these, we have to vote. And I agree. I can't even imagine the dilemma for people whose kids may not be able to go back to school, who work and have to work because they're going back to work. And they want their kids in school. I'm going to quote Mr. Wilson on this. 100% of our parents want their kids back in school. Not 68 or 65. 100% of our parents want their kids back in school. The 65 who are willing to send their kids, that they've indicated are willing to send their kids back to school under these conditions, that is they're sending them back to our schools, assuming that we are creating the safest environment possible. So it's not that they want their schools there, their kids there no matter what, they're trusting us to create the safest environment possible. If they didn't think we were doing that, that number may lower. Just like even in a non-pandemic, when a kid enters our school, they're in our care and we do what we're think is best. Their parents may be a little bit more lax than us, but we do what we think is best. So that is a life decision for people, and they're in positions that I don't envy. I was very encouraged with Ms. Prather here tonight. I was very encouraged to hear she's been through our schools. I think, as I get questions in the community, a lot, I didn't know that, So I think the more that we can kind of, as the people out in Kroger, as board members out in Kroger and are getting asked these questions, no detail is too small to let us know, because we're answering questions for other people too, and we need to get that out.
We did say that.
Yeah.
Several meetings ago, we had talked about Kelly and Cassie doing walkthroughs
Well,
with us.
and I encouraged a lot of people to watch her, because I think, they trust you, but it's always good to hear, especially when you're referring answers to a public health department, to actually hear that from the mouth. But it's hard for everybody, and I think you guys are doing a good job, and the more I learn, and honestly, we can only do our best. So.
Well, and I was just looking over the survey questions and everything, and I do think that would be good to post that so folks can kind of look at it. But I will say, I really appreciate that you and your team, we all received this document, the survey, and I guess you received it at the same time we did. But I appreciate that you and your team have gone and looked at what the staff concerns are and have said, okay, so if you're concerned about PPE, what specifically, you're a kindergarten teacher, okay, so what do you think about, the masks? And then in addition, those kinds of things. Because I think probably, everybody's just trying to do the best they can. And we can't get the risk down to 0%, but as low as we can possibly get it, it is definitely what we want to do. So I just appreciate that you guys looked at that survey also, and that you're taking the information from the teachers and the staff and their concerns, and you're, answering those and incorporating those and addressing those. Thank you.
Okay. I'd like to end my portion of the meeting like I did last week and thank the superintendent. Heartfelt, earnest thank you to each of you cohorts who are here and have worked so hard on this. Thank you. The hard work does not go unnoticed, and I know you're doing the very best you can in an impossible situation. Thank you.
Anybody else have any discussion items?
We actually, unless I missed it, we didn't do old business.
Oh, do we have old business that you want to speak about?
It's the update on financial consultant search and determined scope. We can table that until.
Usually, I think we're leaving these things on old business till they get moved up.
Well, we can move it up for the next,
We can move it up for next Monday if we want.
Ms. Springate, Ms. Springate.
I don't
Ms.
think we need
Edelin,
to do that quickly, but for the next planning meeting sounds appropriate.
Ms. Edelin, if there's no objections, I move we adjourn.
Second.
This motion and a second to adjourn. All in favor, say aye.
Just 1 second,
All
do we not
opposed.
need to
No executive
take
session.
action on the old business? No, okay, thank you.
Thank you all.
Aye.
Everybody, thank you for coming tonight.
Y'all just start taking down the line cables and wiring those up and something nice to do, I appreciate that.
All right.